Yes, please. Rajiv, sorry to hold you. You can go ahead.
Yes, sir. Good afternoon, sir, and all the members of Hadapsar. This is our first CDE event of the year 2022, and we have with us a very renowned speaker, Dr. Baudeep Ahuja. Before starting, let's have a small introduction of today's speaker. Dr. Baudeep Ahuja is graduated from Punjab University, Patiala in 1998. He has 23 years of clinical practice in Ludhiana. He is a triple MBA in hospital management, human resource and marketing from IIMM Pune, IGNOU Delhi and Chennai respectively. He holds postgraduate diploma in medical law and ethics, clinical research, cyber laws, intellectual property rights, disaster management, financial management and bioinformatics. He has more than 300 scientific publications. He has authored 8 books on practice management on different topics. He takes lecture all over India. And at the last but not the least, he has a YouTube channel exclusively for dentists by the name of Dr. Baudeep Ahuja. Without wasting much of time, I would like to call upon Ahuja sir to proceed with the webinar, sir.
Thank you, Dr. Rajiv. Thank you, Dr. Prateek, Dr. Nitin, Dr. Akshay, all the office bearers. First of all, I'll start with my due apologies that I could not actually keep up my commitment on Friday, but it was an unavoidable emergency. So we all have to attend to those sometimes. And I got to know it at the last moment, say around 10:30 or so. The first thing I did was call up Prateek and apologize. And yes, I told him we'll schedule the same in very few days time. You can say in less than 4 or 5 days, and we are here as committed in you can say less than 5 days. We are here doing it as per the convenience of everyone. So due apologies for that, but yes, better late than never. This is today's session, which I believe that is going to immensely benefit all of you. And trust me, guys, there is a lot more than this which we all can learn. So yes, I duly thank all the organizing committee members, president, secretary, honorable traders, honorable CDE chairman, and of course all the EC team for inviting me over to Idea Hadapsar branch. So let's begin the session. Just allow me to share my screen. And before that, just a few ground rules. I'll request you to actually keep yourself on mute mode. But please, if you want, I would recommend you that your videos should be on. But if you have a bandwidth problem, your net does not allow it, you can switch off your videos. Majority are already switched off. But if you can switch it on, let's make it more interactive. And I would request you to use your chat box more often. If you have any queries, please do post. And at various points in time, I'll be telling you a few things to do and post your answers in chat box. And I believe that you all will oblige me. So at the stroke of exactly 2 o'clock, thank you, Prateek and the team, Hadapsar, to actually stick on with the desired time. Let me share my screen and put the proceedings on the way. I have temporarily muted everyone so that there are no disturbances, but still I would request you to still keep your phones on the chat mode, or you can say your audios on the mute part only. So just sharing my screen. So if you can see my screen and hear me clearly, please type LC in the chat box. LC stands for loud and clear. Please type LC in the chat box if I'm visible and clear. This is okay. Thank you so much. Thank you so much. So this is a journey which will be taking for 2 hours and 10 minutes or so, approximately 120-130 minutes of the session or the lecture, a little bit close to that, and followed by queries from all of you. I will not leave till every query is answered. So don't worry about my time. I have margin kept till 5 o'clock. So if you are ready with me, if you are there doing things with me, I'll be sure with you. So let's begin the today's session. Of course, it was earlier scheduled for 11th Feb. Now it is being held today. So let's begin the proceedings. All my presentations always will begin with thank the Lord Almighty, who's given me much more than what I deserve. And when it, this is my actually, you can say, brief CV, you all are aware of it by now. So let's not waste time over it and go ahead. So this is the topic for today. A few practice management skills in dentistry. Of course, we cannot do everything, but whatever maximum I can, you can say, try to cover in this short period of 130 minutes or so, I'll do that, surely. So this is the event for which we are here. You already were notified of the topics: charging your worth, negotiation skills, how to deal with warranty guarantee issues, patient satisfaction, patient retention strategies, bargaining, handling. So at any point of time you have any query, do post your query in the chat box. If possible, if feasible, if not getting out of the topic, I'll surely try to answer it there and then only. Okay, so let's begin. So these are the topics, as I said. It is like a story which I'll be weaving for you. Just try to listen to the story, and actually, of course, all the threads should be joining at the end of these 2 hours and 10 minutes. So always my practice management sessions begin with a disclaimer. I do not claim myself to be a practice management guru. I just have, we can say, I'm a simple person with a few differently enabled fundas. And I can always say, I always do say this, my fundas will not actually appeal and apply to everyone. So Dr. Prateek and the team, all the co-hosts, please keep on admitting the guests, because otherwise it will be showing on my screen and will be interfering with the presentation. Please, thank you so much. So my fundas won't appeal and apply to everyone, but I'm sharing them because they have given me success. I'm into the 23rd year of my practice. I started my clinic on 1st Jan 2000 with the dawn of this millennium. So you are free to copy my ideas, but do apply them in at your own risk in your practice. Of course, the important thing is that you have to imbibe the basic philosophy behind it. You can say, understand the logic and then go about the task of copying it. Practice management always is not about the tips part. People always worry about the tips, ki hame kuch tips mil jaye and we'll be, you can say, improve our practice drastically overnight. Trust me, I'm here to disappoint you in that regard. Practice management is not a magical wand or you can say a magical potion or a syrup that you will drink and overnight and from Wednesday morning tomorrow onwards, you'll have more patients in the clinic. This is not going to happen. This is actually a process, and the process starts with you. The changes are first to be in you. They have to be in you, in your behavior, in your practice, and then of course, with the application of some smart tips, you can actually go and apply them for your confidence and success. So kindly try to understand the broader concept which I'm teaching you, because again, practice management is all about marketing yourself and your practice. And when we talk of marketing, the only thing that comes to our mind is advertising. It is not only advertising or marketing or only external part. It is actually, you can say, that is the expensive part. It is more of an internal part. Why do I say that? Because just look at our Bollywood movies. Again, COVID times discounted. Look at the normal times. What do Shah Rukh Khan, Salman Khan, and Akshay Kumar and all those top stars do? Type in the chat box, what do they do to a new Bollywood movie which they are starring in? Just in one word or one, two words. Type in the chat box. I'm waiting to listen from you, to read from you. What do they do actually to a new movie? Promotions, great. Dr. Sonam says promotions. Dr. Disha says promotion. Yes, go ahead, go ahead. Anyone else with a different thing? What do these stars do on a Friday? The movie, when it is being released, what do the stars do? Visit Kapil Sharma show. Of course, they visit before that, but it is telecast on, you can say, Saturday or Sunday. Yes, yes, I can understand. What else? They have their face value. I want you all to be more interactive with me from now on. So they have the face value via which they can actually pull in the crowd on a Saturday or a Sunday, or Friday, Saturday or a Sunday. Of course, in this you can say world of social media, movie pit jayegi agar wo you can say if it is bad in content. But let's forget about those things. Still, people are not that much reading those reviews on social media, except those who are penny wise, pound foolish, maybe. So, but otherwise, what do these stars do? They pull the crowd for the first 3 days. But Monday on, apply the same formula in your n number of things in your, you can say, in your practice. N number of things in practice to pull patients in. But once the patient gets the door into your clinic, the external marketing ceases to act, and that is where the internal marketing takes over. What exactly is internal marketing? It is actually a combination of what you actually believe that is going to yield results to the patient, your behavior, your work skills, your staff's behavior, and a few other things, of course, coupled with the, you can say, various practices which we are employing in our clinic sojourn to actually make patients happy and satisfied. So internal marketing is the major thing once external marketing is there. Once the patient has come in, he is not satisfied, he is not happy with you. Trust me, even if he sees your ad again, even though he sees your ad at a 50 or a 70% off, although it is unethical, of course, but if he sees an ad from you, he's still not going to budget, because he has been there, done there. He knows that what kind of system you are, what you can say, what exactly you stand for, what is your brand value, what exactly you were promoting, and what actually you turned out to be. This is the way things go. So we need to understand those parts very clearly. So let's come to the task about the profitability part. We all want a profitable practice. Didn't we start the practice because of that? Surely. But what exactly is profit? If we deal with the profit part, profit is actually income minus expenses. You can say whatever is left is our profit. Are you sure? How many of us are sure that income minus expenses is profit? Type yes in the chat box. Or if you say no, then type no in the chat box. Whatever you wish to. I'm waiting. Go ahead. Income minus expenses only. Is it profit or is it somewhat more than that? Do type yes or no in the chat box. Guys, be more interactive, be more participative. No. Those who are saying no, tell me what exactly is involved in the expenses, or sorry, in the profit, to call it a yes. What more do I need to get from you to call it a profit? Okay, so when we talk of profit, we say income minus expenses, and when we talk of expenses, we see the direct expenses. Ye material tube is for this much amount. The lab bill of the crown is for this much amount. That is what we call as the expenses. Is it so? No. Is it not? No, it's not. So what exactly it is? Let's see ahead. So even if we are, you can say, you're earning lots of money, your goal is actually to have a sustainable thing, and then ultimately to have more of practice. So, but the thing is, we are actually rewarding our patients with a fantastic patient experience as well, to provide them with the best standards, or if any cutting edge technology you're using. But then at the end of the month, everybody has this complaint. मैंने कमाया तो बहुत था, लेकिन मेरे पास कुछ बचा नहीं. Where does the money go? Where does the money leak? Which is the leaking bucket in our clinic? So this is what we need to understand. The charging and the, you can say, pricing in our clinic has not to be based only on your direct costing. It needs to have a lot of direct cost. There are 27 to 28 kinds of costs which are there. In dentistry, 16 types of costs are there, other than the direct cost I'm talking. And you can say more or less 12 or 13 are applicable to us also out of those 27 or 16, whatever number you want to. So let's go ahead and discuss a few things about that part. But let's see a few broad reasons why are not we able to satisfy patients. One of the most commonest reason is कि इतने में तुम्हें और क्या क्या दे दें, because the charges are already low and the focus is on everything other than what really matters for the patients. Because some clinics do have a lot of expenses and they really don't know. They are spendthrift, they actually invest in newer things every now and then without actually looking at where does the money in your clinic come from. Somebody is a periodontist, he is investing in perio gadgets, and actually money in his clinic would be coming in from a lot of crown and bridge. So who is investing in a physio thing or ultrasonic thing or whatever, say, advanced gadgets needed for the surgical part, which he hasn't done even once. The passion, the purpose, and the profit, they have to be defined separately. Many a times we don't know where the money is coming from, and we try to invest in those things which we like rather than what actually is giving us profitability. And the same applies to the, you can say, the charges as well. So even if you are the best dentist in your town, if you're not managing your money right, you're not going to build a profitable, you can say, and a sustainable practice for long, for sure. That is are done over there. So I'll ask in a different manner. What is profitability now? Is it more income? Is it less expenses? You will say both, because ज़्यादा income होएगी, less expenses होएगा. So actually you can say we will do it, but then people look at one of the above thing only. That is called as the myopic view. I will look at both of them. I'll focus more on increasing my income and decreasing my expenses. And if I have to increase my income, I have to raise my charges. If I have to decrease my expenses, I have to understand costing. What exactly is my costing? What exactly are my numbers? A myopic, telescopic is a common word. But what word I use is the bird's view and the worm's view. Eagle ka view or कीड़े ka view. That is the best way. A macroscopic and a microscopic. That is the way we can define it. So profitability is not exactly a rocket science. We all need to have that relationship going between income and expenses. So because so many clinics will struggle with profitability, the reasons are endless. So let's see, you can say today's presentation is all about taking these both aspects into account. When we talk of charging and pricing, we don't talk of how many charges are you actually inculcating. Or you can say, how many charges are you charging from your patient? And when it comes to expenses, what is actually your costing part? How you can say are related to that. So let's see first the ways to make your dental practice more profitable, more income wise, then we'll see the expense wise. The income side first, of course. So the number one aim should be to concentrate on increasing the practice volume. The treatment acceptance rate has to be increased. Can anybody tell me what is the average acceptable case conversion ratio, case acceptance rate in a clinic? कि आपके पास 100 पेशेंट आते हैं, कितने कन्वर्ट होते हैं? What is the ideal patient conversion rate? Can anybody tell me? Type that in the chat box if anybody can tell me. How much is the percentage out of 100? If you see 100 patients in a month, new patients, of course, what is the, you can say, ideal conversion rate? 70, 40, go ahead. 60, I see on the Facebook also 80, 60. Okay, so guys, be more interactive. You learn via sharing only. If you're doing your clinic work and along with that the video is on, you're not learning anything. I'll tell you that. Even if you watch it on repeat mode, the live is the best way to actually interact. So 72 is the exact ideal acceptance rate. Of course, anything more than that is wonderful. Anything less than that, you can say, is a reasonable range till 55, 60. But anyone below 50% of conversion rate is actually not getting the full value or not using the full value of consultation or his internal marketing properly. So you can actually schedule more number of patients, but if those patients are not getting converted in your practice, you are not going to actually carry home much amount because your revenues are not going to increase. You're going to be static in those parts. COVID has actually taught us that if we actually increase our practice efficiency, and one of the best ways by that is scheduling is a patient in a longer setting, because you inculcate less cost in that part. You are able to accomplish more because once you adopt the rhythm, you are actually getting more. So this is one part. Then minimizing your chair downtime when you have a multiple chair unit practice. So next, when you actually do appointment scheduling in an effective way, you can actually make use best of your 8 to 9 hours which are you working in clinic. There is no fun in displaying मेरे clinic में 5-6 patient हमेशा बैठे रहते हैं. That is stupidity. That is a thing of the past. You don't need to show someone thing. वो किसको दिखाना है? पिछले 12 साल से मेरे वेटिंग में शायद मैक्सिमम 1 या 2 बैठे होते, वो भी नहीं बैठे during the procedure. If the procedure is long, we are not showing someone something. You need to remember. I shifted to full-time appointment practice in 2007. My first, my elder daughter was born in March 2007, and with her, she brought the good luck. And my OPD literally zoomed 4 to 5 times after her birth. For the first couple of months, I was struggling. I could not actually make a miss and match. How do I adjust my patients? How do I make them? Because at the peak time, there were always 6-7 patients sitting in the waiting. In those peak times, maybe in 11 to 12 or 10 to 12 in the morning, 6 to 7, 5 to 7 in the night, on the evening, I could do maximum 2 or 3. But then eventually the remaining used to turn away. And then I changed that system. It took me 1 year to fully adopt that system, but things changed. Things changed better. My friends laughed at me. Those in ID and those beyond ID also, they laughed at me. Mine is an industrial town. Basically, you all have known, Ludhiana is known as the Manchester of India. We are known for hosiery goods, cycle parts, and of course, cycle manufacturing industry also. So predominantly woolen and cycle. So we are basically a business town, and people actually laughed at me. तुम लुधियाना वालों को टाइम पे लाना सिखाओगे. So I was actually in a fix myself whether I'll be able to do it or not. But then I did it, and within 1 year I was able to settle that system in my practice. And then onwards, it has been, you can say, even in COVID times, I didn't face this problem because people were already aware of the system. They already used to call me and then come. So COVID, we did not face any problem after the first 3 months because people are used to this system. Any system that you adopt in your practice is going to take some time. But trust me, effective scheduling is one of the best selling points of your clinic. Nobody wants to wait. I remember when I was a student, or even before that, my dad used to take a half day leave to go to his dentist in my town. I used to ask him, Dad, आपने अपॉइंटमेंट लिया है फिर भी आप आधे दिन की छुट्टी ली, why? He used to say, dentist के पास जाएंगे 2-3 घंटे तो वेट करना ही पड़ता है. That is what the dentist was synonymous with in the 90s. But in today's times, majority of the dental clinics, good dental clinics, don't make the patient even wait for 5 to 10 minutes. And that is one of the biggest selling point. Trust me, time किसी के पास नहीं. But if you feel this small factor can actually grow your practice, yes, it does. And not one, there are so many case studies of my own friends, my own, you can say, batchmates, my many youngsters who have actually learned this concept of effective scheduling, and they are doing it. Again, this is one of the factors of internal marketing. This is one of your selling point. Doctor के पास rush नहीं होता, appointment low, he doesn't make you wait. Then a good fee structure. If you are actually charging low, you are actually digging a grave for yourself. I say this point very, very commonly. That कुछ लोगों को होता है ना, कुल्हाड़ी पे पैर मार लिया या पाँव पे कुल्हाड़ा मार लिया या किसी ने कुल्हाड़े पे जंप मार ली. Dentists are one community who are fond of doing a bungee jumping on the kullada. So get rid of this phenomenon. Get rid of that theory कि शुरू में रेट कम रखो, रेट बढ़, जब ओपीडी बढ़ जाएगी, then we will, you can say, अपने रेट बढ़ा लें, तो बहुत सारे पेशेंट आ जाएंगे. It doesn't happen that ways. So with effective marketing, your increased efficiency and your better fee structure, you can build your practice volume, you can say really soon. But you are stuck in that market idea कि patient बढ़ेंगे, pay rate बढ़ाएंगे. That is the hatti chatti vatti theory of, you can say, it was a coal industry theory or economics theory of the 1840s. 180 साल हो गए इस theory को, और वो भी coal industry की थी, economics की theory. How did it come in dentistry? I don't know. But people have this notion. बड़े बुजुर्गों ने जब भी आप क्लिनिक बोलते हो बेटा पहले रेट कम रखो, पेशेंट आने दो फिर बढ़ा लेना. And then you are getting when you start working, you have happy patients. Then you have this fear. ये patient मेरे से खुश हैं. And you forget this thing. They are not happy because of your price. And you feel अगर मैंने रेट बढ़ाया तो ये patient भाग जाएंगे. We need to realize pricing is not the criteria patients choose us. It may be in top 5, but it is never in top 3. The reason patients choose you. Everybody knows dental treatment is expensive. But if you are offering good service structure with that, good skills with that, good diagnosis, good treatment planning, you can say your staff is well behaved, your behavior is well, you can say well structured, well mannered, well cultured way of treating the patients, you can be assured of giving a good service to the patient. And this is actually a big, you can say, roadmap in the growth of practice. Then the second thing, as I say, big fan of internal marketing. So ask your patients who are happy to write you testimonials or Google reviews. चाहे घर जाके करें या आपके क्लिनिक में बैठ के करें. You can say patient incentives like you have your own stationery in the clinic, your coasters, pen, brush stand, whatever you can say. If somebody is giving it, offer them something. This can be an incentive, of course, to go that. Plus, it serves as your brand remembrance in the patient's mind so that they see those things in their house and they remember it. So this is, you can say, a way where you can incite a desire to put in a review over there. Then always keep a close eye on your collections. Whatever you are earning, your gross revenue or your gross collection in the clinic. Sometimes actually they count revenue without counting the collection rate properly. So if you believe that you have, let's suppose, earned 1 lakh in your practice, but कि 1 लाख का काम मैंने कर दिया, लेकिन आप उसमें से 75,000 आपकी पेमेंट पेंडिंग है, तो how are you going to actually survive? How do we know that those patients are going to pay? Because you don't have a system for payment. Many of you may be having, I'm just saying it generalized, not pointing it out to any one of you, but that is the way actually things go. People don't charge till the last moment also. Or they want to charge everything upfront. They don't give you can say, a breakup of the treatment plan, treatment charges. And they want the patient to assume and presume, कि इतने तो लगते ही हैं, आप कहीं से भी पूछ के देख लो. The patient is not supposed to do that. So then make sure the patient understands the cost of the procedure upfront. You are not going to make them suppose कि root canal का इतना price तो सब जगह चलता है. Tell them beforehand. If that tooth needs a crown, tell that also beforehand. Some people will say, नहीं मेरे को वो crown नहीं लगवाना है. I said, auntie, uncle, you have walked in the pain today. Your tooth needs a root canal. Of course, not going beyond. आपने basic चीजें तो ignore करनी नहीं है ना. जो basic trials करनी है, pre-operative X-rays, any investigations, any other radiological things you need, उनको ignore नहीं करना. But let's put them aside for a moment. Tell the patient your procedure, because your tooth is broken down, it will need a root canal to relieve you of the pain and of course get rid of the infection. But this procedure is not complete without the next 2 steps. The core filling or the post-operative, you can pronounce it the top filling or whatever, and a crown on top of it or a cap, whatever you explain the patient language to the patient. Explain it that there are multiple types of crown from metal to PFM to zirconia, but we will discuss it when the opportune time comes. But if you are presuming that this root canal cost of 2,000, 3,000, 4,000, whatever you are charging is including everything, no. This includes only the root canal cost. This does not include even the top filling. If you're doing it, add that this includes only the root canal and the top filling or the post-operative. Whatever you're doing it, it is your duty to convey that at first. Because if you do it, कि पहले वो बताओ, फिर दूसरे स्टेप पे वो बताओ, कोर का फिर तीसरे स्टेप पे वो बताओ, the patient will feel यार एक ही बात सब पहले क्यों नहीं बता देते आप? हम पहले इसलिए नहीं बताते कि सीधा 8-10 हजार बता दिया for all those three things with a PFM crown, the patient will run away. No, they will not. No, they will not. जिन्होंने रन अवे करना उन्होंने रूट कनाल प्राइस से रन अवे करना. It is as simple as that. You have to get rid of your fears and inhibitions first before you talk it out to the patient. Trust me, these all things are coming from my 22 plus years of experience. I'm not telling you anything from the book. So then the consent part. Always, I take workshops on customized consent also. And our payment structure is included in that consent. And that consent is witnessed also. 4 signatures. Patient accomplice, patient dentist accomplice means my assistant, patient's relative or whosoever has come, the patient and me. 4 people sign it. And it becomes a legal binding document for the patient. Then offer all payment options. Never ever go in for the options that we will actually, you can say, go about the task of कि हम तो सिर्फ कैश ही लेंगे जी. Whatever way you have multiple, आजकल QR कोड है, स्वाइप मशीन तो पहले से थी, नेफ्ट है, ऑनलाइन ट्रांसफर है, IMPS है, there are so many modes. But because we want to inculcate or have more of black income, we will actually go about insisting only on the cash payment. Always have some advance deposit because you are not mentioned your details to them. So you are not sure of asking them as well. And then try finishing your payments before the third last or the second last sitting. Always do that. But वो सारा कुछ करने के लिए आपको एक सिस्टम बनाना पड़ेगा, एक अच्छी कंसल्टेशन करनी पड़ेगी. The problem is our consultation actually happens भागते भागते चलते चलते including. We never sit down level to level. We don't schedule time for consultation. We don't make the patient understand. हमारी अप्रोच ये रहती है, majority of us patient आया कुछ ना कुछ करके थोड़े से पैसे डिपॉजिट करा रहा है. वो एडवांस डिपॉजिट हम लोग सब करते हैं, कुछ ना कुछ करके इज द अप्रोच. चाहे कॉटन डाल दो, चाहे कुछ कर दो, फवारा मार दो, कॉटन डाल दो. ऑल दोस you can say ideologies still work in smaller towns or you can say tier 3, tier 4 centers. They still work. For the dentist, they believe that ऐसे कर लेंगे तो पेशेंट हो जाएगा. Ask yourself, you went to a mall, आपको कोई ऑफर मिल रही थी 50,000 की, they wanted only a deposit of 1,000 up front, तो आपने दे दिया, आपको ऑफर लिक्विडेटिव लगी, you paid 1,000 up front. घर आके डिस्कस किया, देखा, गूगल किया, बातचीत की, यार ये तो ऑफर है नहीं है, तो 50,000 इट इज एन ओवररेटेड ऑफर. सो व्हाट विल यू डू? ये तो 30,000 में मिल रही है ऑफर. What will you do? Will you go back and pay that 49,000? No. You will like to forego that 1,000. कि चल छोड़, 1,000 गया फड्डे में, कोई बात. It doesn't make any difference. That is the way we have to realize. The patient can also forego the advance deposit with you, and then we keep on calling. आप आए नहीं, आप आए नहीं. ओ मेरा दर्द थोड़ा ठीक था, मैं busy था, मेरी शादी थी घर में, and all that, all those excuses. I'm traveling. Sometimes they might be genuine also, but those excuses actually then tell the patient. Then actually doing about that part. Dr. Siddharth, the consent form is not the one which we use. It is a customized consent form. It is made for every patient. There is no stereotype like the IDA consent forms of head office or any ones you find. Those are the bodies of the consent form. The total consent form is customized. The top and the bottom has to be customized. It is a full process. The how is totally eliminated in that part. So I don't have a fixed consent form because we make it new for every patient in less than 10 minutes. In less than 10 minutes for every patient. So there is no fixed format for that. Whatever you want to find on the net, you will find it, but that is only the body of the consent form. So when you try to finish out this system before that part, you'll know it that the patient can actually be in sync with you, whatever you wish. So don't undercharge your patients and don't undervalue your time. We do both. We do undercharging in the cost, you can say the pricing part, and undervalue our time. कोई बात नहीं, थोड़ा सा टाइम ही लगा, कोई बात, इसमें क्या होता है? And we don't base our fee on our skill, time. Anybody who does that, I always tell them, go ahead, go backwards, go to your BDS time. याद करो अपना final year कैसे मर मर के पास हुए. Even those who are toppers, the BDS final year is one of the toughest UG curriculums in my purview. जितना सब्जेक्ट theoretical load plus the practical load हम लोगों पे होता है, उतना शायद MBBS पे भी नहीं होता. So I can strongly say BDS final year is the toughest UG curriculum in India, and I'm proud of it. I'm proud to be a dentist. Even proud to be, I would want to be reborn as a dentist only in my next birth. So you need to understand, if you forget that time, you are actually undervaluing yourself. You are undervaluing yourself, your profession. Just in this thing कि वो बाजू वाला डेंटिस्ट कम चार्ज कर रहा है. अरे बाजू वाले किसी मल्टीप्लेक्स के साथ सिंगल स्क्रीन होता है, तो उनके पास अपनी ऑडियंस है, उनके पास अपनी ऑडियंस है. Why do you why do you want to treat everyone in your area? You don't need to. You need to have your own specific target group. And if you are giving the correct value to the patient, you are adding your services. कि डॉक्टर महंगा तो है पर काम बड़ा अच्छा करता, काम बड़ा तरीके से करता, वेट नहीं कराता, स्टाफ बड़ा वेल बिहेव्ड है, पूरी इंस्ट्रक्शंस दी है, सारा कुछ काम तरीके से बताया है. दिस इज व्हाट पीपल वांट एक्चुअली. स्पून फीडिंग. दे वांट एवरीथिंग टू बी गिवन अंडर वन रूफ. एंड व्हेन दे आर गिवन एंट्री, अब इतना कुछ मिला है तो दे हैव टू पे समथिंग इन बार्गेन. 1000 रुपए में फिलिंग तो शायद 10 बंदे कर रहे हो, बट इफ यू आर चार्जिंग 1200 1500, दे वुड वांट टू सी योर सर्विस स्टैंडर्ड्स. आप मल्टीप्लेक्स जाते हो, आपको मालूम है सिंगल स्क्रीन में 50 रुपए में मूवी देख लोगे, फिर भी आप 200 रुपए देते हो मूवी का, 250 300 देते हो. 30 रुपए के पॉपकॉर्न के लिए आप 200 रुपए देते हो. कोई आपकी जबरदस्ती पॉकेट से तो नहीं निकालता ना. इफ यू आर पेइंग दैट बिकॉज इट इज योर विलिंगनेस, यू वांट टू एंजॉय द टाइम, यू वांट टू एंजॉय द एटमॉस्फेयर, यू वांट टू एंजॉय द एम्बियंस. यू सेड लाइफ में सब कुछ पैसा कमाना नहीं होता है, एंजॉय करना भी सब कुछ होता है. एंड ऑन फ्लिप साइड, वी टेंड टू अंडरवैल्यू हेल्थ. Nobody searches for a cheapest endodontist on the net. They'll always search the best endodontist or the best root canal specialist on the net. ये हमारी सोच है, हमारी आइडियोलॉजी है कि लोगों को सस्ता काम चाहिए. There is so many of people who actually do it. So many of you who are in this room right now are females. If I try to sell you, मैं बोलता हूं आपको ये 100 रुपए किलो का सेब है, लेकिन ये 5 दिन पुराना है, तो मैं आपको 80% डिस्काउंट पे 20 रुपए किलो में देता हूं. All the females in the room, will you buy that fruit? Tell me in the chat box, will you buy that fruit? Yes or no? I'm giving you 80% discount. I'll give you 80% discount. Will you buy that at 20 rupees kg? These are 5-day-old apples. Will you buy them? Ladies, please wake up if you're not. Dr. Archana says no. Dr. Sneha says no. Only 2 females in the house. Dr. Palvi says no. Dr. Deepa says no. Dr. Uttara says no. Great. Great to see so many responses. Why? Why do you say so? Dr. Disha, you can type to query in the chat box. No problem. If you have any. So if you can't buy a 5-day-old fruit because you feel your health is more important than 80% discount. Can't the patients understand this thing from you? Everything is a gateway. That is done in the mouth is a gateway. Everything goes through the mouth, inside the body. The mouth is the gateway. Why will patients not understand this thing? Because आपने कभी try ही नहीं किया. But वो आपने try किया, fail हो गए, तो you never tried it. The elephant theory. एलिफेंट का बच्चा होता है ना जब छोटा, तो इट इज टाइड टू अ यू कैन से स्मॉल पेड़ और अ ट्री with a rope, with a very you can say thin or a thick rope. And elephant baby being a small baby, it can't get rid of that rope which is shackling its foot. But as the elephant grows inside, it becomes a mighty structure. It becomes huge in weight. 500 किलो से ऊपर 1000 किलो का बन जाता है in weight. बट वो उसको स्टिल उसी रस्सी से उसी पेड़ से बांधा जाता है, चाहे पेड़ बड़ा हो चुका हो तब तक या छोटा भी रहे तब भी. बट इट स्टिल डज नॉट, उसके लिए तो बड़ा पेड़ कुछ नहीं, वो ऐसे पैर हिलाएगा तो बड़ा पेड़ भी उखड़ जाएगा शायद. बट इट स्टिल डज नॉट डू इट बिकॉज उसके माइंड में कंडीशनिंग हो चुकी, बचपन में मैंने ट्राई किया था, आई फेल्ड एट इट, सो आई एम नॉट गोइंग टू ट्राई इट अगेन. एंड जस्ट बिकॉज यू फेल्ड एट समथिंग in convincing a few of your patients, now that has become a norm with your mindset. 2-4 पेशेंट को करके देखा तो कोई मानता नहीं, सबको सस्ता काम चाहिए, तो हमने भी अपनी प्रैक्टिस वैसे कर ली, या हमने प्रैक्टिस ऐसे कर ली है अपनी, लेकिन वी आर नॉट मार्केटिंग. देयर इज अ मल्टीफैक्टोरियल अप्रोच. टेल देम व्हाट वैल्यू आर यू प्रोवाइडिंग एंड दे विल बी रेडी टू पे. बट वही ना, अगर वैल्यू भी नहीं देनी है, 2-2 घंटे वेट करवाना है उनको, काम भी क्वालिटी का नहीं करना, फिलिंग्स भी, मटेरियल्स भी सब स्टैंडर्ड यूज करने हैं, क्राउन्स भी ऐसी लैब से करने जो गेट स्टिप एवरी नाउ एंड देन यू कांट एक्सपेक्ट रिजल्ट्स। वो रिटेंशन ऑफ पेशेंट्स नहीं आएगी, वो रिकॉल वैल्यू नहीं आएगी, वो ब्रांड वैल्यू की रिपीट नहीं आएगी। यू नीड टू अंडरस्टैंड दैट पार्ट वेरी वेरी क्लियर। सो एक वो लॉजिक देते हैं ना बहुत सारे स्पीकर्स, I have learned this to do in 5 minutes in the past 20 years. So I'm charging 5,000 for this, for these 5 minutes. वो आपने कहानी सुनी होगी, एक शिप में प्रॉब्लम आ जाती है तो वो कहते हैं बहुत सारे इंजीनियर्स को बुलाया जाता है, तो सब आके देख लेते हैं, कुछ नहीं होता। फिर एक वो बताता है कोई कि एक बूढ़ा इंजीनियर है, वो छोटा सा काम करता है बट कॉलिंग ही इज वेरी एक्सपर्ट। वो आता है, देखता है, सब इंजीनियर फेल हो गए, ये क्या करेगा। वो अपना एक हैमर निकालता है, एक जगह पे हैमर मारता है, तो एंड द शिप इज स्टार्टिंग, द शिप गेट्स इनटू एक्शन। तो वो कहते ठीक है आप अपना बिल भेज दीजिएगा। तो व्हेन ही सेंड्स द बिल इज फॉर 1,000 rupees, $1,000. This how much, why this hefty amount of bill? Said $1 for hitting the hammer and $999 for hitting for knowing where to hit the hammer exactly. So if you are not charging as per your brand value, even after 5, 7, 10 years of your practice, you're actually doing disservice to you, your family, and your future. I speak on 3 topics predominantly: practice management, medical legal, and finance. I make a triad of all these 3. How come? Because we all want to earn more money. And in a zeal to do that, we cross on the wrong side of law. There, the medical legal tells us to tread the right path. And when we are doing everything right, earning money in the right perspective, we need to make that money earn for us, grow for us, give us a MSI, multiple streams of income, or a passive income. So this is the way you need to. So अगर आप अपने चार्जिंग नहीं कर रहे हैं, where are you building your future from? आपको पेंशन नहीं मिलने वाली है, इतना याद रखना. Except of those who are in GDC or any other college, only a handful of you would be there. उनको छोड़ के बाकी किसी को पेंशन नहीं मिलने वाली है. And even I'm not sure, even many state GDCs have a contract jobs, which means they will not have any pension. So you need to realize absolutely that. अगर आप आज कमा नहीं रहे हैं तो कल आप खाएंगे कहां से? Remember the lockdown? 23rd मार्च को लॉकडाउन है, पहले सबने मैगी पिज्जा पास्ता पार्टी की. ला भाई 3 हफ्ते की छुट्टी हो गई, बहुत मजा आ रहा है, एंजॉय कर रहे हैं, अच्छा है, लाइफ में ठहराव आ गया, हवा फ्रेश हो गई, सड़कें खाली हो गई, दुनिया से कनेक्शन बढ़ गया, फोन पे हो गया. ठीक है, मन में डर था कोविड हो जाएगा, एवरीथिंग. बट देन एज द 3 weeks came to close, everybody had that itch to go back to the clinic because they never had a emergency fund with them. किसी ने तो, बहुत लोगों ने तो नाम भी नहीं सुना था ऑफ इमरजेंसी फंड. सो इमरजेंसी फंड है नहीं, सेविंग्स है नहीं, तो क्या होगा? सर पे कफन बांध लिया, कोविड से लड़ने के लिए जा रहे हैं हम अपनी क्लिनिक. पेशेंट है या नहीं है बात अलग है. सो वी डिड इट, मेनी ऑफ अस डिड इट as good as 15th or 16th of April in 2020. So you need to understand, if you execute and explain the patients the proper value, and that explanation can come only with proper consultation. और मैं तो कह ही रहा हूं आपको, आइडियल 72 है. 100 पेशेंट कंसल्ट करोगे तो 1/4 नहीं मानेंगे. So what? You win some, you lose some. You do a good consultation and you expect a 72 ratio. But अगर आपकी उल्टी आ रही है, आपके 28 plus आ रही है, 72 minus आ रही है, you need to look at a few things. Then something might be actually wrong at your end. In the internal marketing part, in the diagnosis part, in the, we can say, skill part, मैं आपको जो सिखा रहा हूं, that is still 20%. In a clinic, your 80% domain skills are more important than your 20% skills what you are learning from me today. They're part of the 20% skills. So domain skills will be still primary. You need to understand that part very clearly. So always confirm appointments from them if you have that system in your practice, because sometimes so much time is wasted. Use a software, use a, you can say, a SMS system, whichever way to, or your staff to call if you're doing elite practice and you can handle that part. Whichever way, the automation process has to be set into the practice in one way or the other. But yes, many times for your VVIP patients or your CAS patients, you need a human touch also. So a human reminder is also needed, surely. Then the fifth part, don't focus too much on bringing in new customers. कि नया पेशेंट आना चाहिए, वो इंपॉर्टेंट है. अरे भाई साहब, नए पेशेंट को पुश करने के लिए आपको फिर 0 से 10 का स्टेप फॉलो करना पड़ेगा of internal marketing, which actually is not possible many a times, and people will falter at second, third, or fourth step. But an old patient who is a happy and a satisfied and a retentive patient from your side, he will actually can come to you for more work. He can send you referrals from his social circle, friends, family. एक patient एक आपका BA बन जाता है. BA means brand ambassador. So you need to understand that वो advertising या वो चीज, yes, it is important, especially for a newcomer, especially for the middle road, the stable side, and somewhat for the existing owners as well. It is not only, you can say, inorganic thing. Organic mix is also required. अब organic क्या होती है? Organic is the natural reach. आपके Facebook page के through, आपके YouTube के through, whichever way the patients are attracted to you, the hook, with the way patients are. Marketing में हम लोग ये use करते हैं word hook, which is the hook that you use to actually attract patients. Unfortunately, we have concentrated on the least possible, or you can say least favorable hook, the pricing part. I normally take I have my WhatsApp community, so I take lives for them every Monday and Thursday. Yesterday, Monday live was on a topic of desperate advertising by an endodontist who has been working in Maulana Azad as well. Of course, I blurred out the names and everything, but this is the way people are doing it. So I'll give you the link, of course, in the end, if you can, if you want to watch that, or if you want to be added in my community, I'll give you that. But then we always focus on new patients, the retention of the old patient, which is a topic for today as well. So retention of the patients is more important than anything else in that regard. So this is not as difficult as it seems. So guys, these are a few things. Apart from that, of course, invest in things that increase your revenue, your gadgets, your materials, which can increase your revenue, which can make your work easier. They can actually do it. But we need to focus on that. But I gave you an example, a periodontist having his majority income from Crown and Bridge, investing on a piezo or electrical, you can say surgical gadgets, for which he hasn't had a patient since the past 6 months. He can think of, if he has an ample amount of Crown, he can think of a digital impression, which is getting the in thing today. So you can eliminate the impression part totally from the physical impressions totally from his clinic. This is a big, you can say, selling point. But the two things, to make patients happy and boost your practice visibility, both online and offline, you need to invest in technology and facility improvements in your clinic. And those things also will then become a part of your internal marketing journey. Of course, those who are your old retentive patients, as I said, you can offer them some freebies like your clinic stationery. That is okay. That will serve as your brand remembrance also. Make sure it is in kind and not in cash. For your old patients, you can offer them a free follow-up after 3 to 6 months, just for a routine checkup. But only for your brand ambassador, not for everyone. You can use them as a hook to pull them back into clinic, to get them reminded of the pending work they have, to make them remember the excellent service that you had provided in the first place. You need to know. So if you're thinking it is too much of information, picture abhi baki hai mere dost. Let's see the expense side now. I've told you about the ways and means to increase your practice, increase your revenue part or the income part. I'll deal, of course, with that part a little bit more in the further part of the presentation, but let me give you the expense side first. So we don't know actually the exact cost of our practice. We just look at the direct material cost and we make it to be. We all know, since the session is going on my page also, we all know how much does a PFM crown cost. I don't need to say it in the numbers over here, but we all know what is the lab cost. But it is not the only cost that we are incurring. Trust me, your total direct cost is 2.5 times of that. We have calculated it. I have all the costing videos done last year. I made a costing formula also on net profit margin. Of course, it is an exhaustive formula, but the videos are there on YouTube. I'll give you the link at the end. But this is the way. The direct cost means other than the lab cost, which you are directly paying, is your 2.5 times. And if you add the indirect cost, they are sometimes 50 to 70% of the same, sometimes even exactly 100. So actual cost will become almost 4 to 5 times of your lab cost. What that crown is costing you. You know what a crown cost? अब जब मैं कह रहा हूं आपको सारी चीजें ऐड करके 4 to 5 times the actual landing cost. But if somebody is doing a crown in 1800, 1500, 1200, it is your choice. I started my clinic on 1st Jan 2000. As I said, I had no benchmark, I had no MBA. So what was the reference point for me? I worked in GTP hospital in the morning because I started my clinic initially for the first 3.5 years in my evening OPD only. So I was working in a job in the morning in GTP hospital. So in that hospital, the PFM crown was being charged at 50. It was a charitable hospital. It was being charged at 1500 at that point of time. And I kept the same charges in my practice. 22 plus years down the line, I see people charging 1200 also in my town. I don't know what to say. This is the classical example of dentist doing a bungee jumping on a crown. Yes, I can understand they may be getting a ceramics or something, a cheaper option from the lab. But even then, if you count the percentage of that, you are still incurring more cost, direct plus indirect. We don't know how much that one particular service is costing us. Have you ever tried, any one of you tried to work out what is your exact cost of one composite, exact cost of one crown? No, majority of us have not, or most of us have not. But if you know how to do it, I have a formula for that. I'll tell you in the end, of course. You do it, calculate it yourself. It can vary. But once you know your numbers, then only you'll be able to charge. People ask me, how do I charge? What is the formula? I can give 4 to 6 times of your basic cost, say 7 to 8 times of for your middle road procedures, 10 to 15 times for your high value procedures. You can do it from just the direct cost, the lab cost or the material direct cost. You can do that. But that is a wrong formula. That is just a broader formula, a broad spectrum antibiotic like tetracycline. It will not work in every condition. What you need to know is your customized working. I might be using a different material. You might be using a different material. So we both may have a different set of costings, even though our lab might be same. Even though our lab might be same, you will still have different set of costing because of the input cost. Our assistant may be highly charged, highly priced, or the salary, I mean. Our materials may be different. We may be following a rubber dam approach. Our neighboring dentist may not be doing it. So similar way, the costing actually comes into there. So then the second expense is, do not spend too much time on low value activities. People are fond of doing everything by themselves. मैं सब कुछ करूंगा. Assistant patient के पास खड़ा होता है, dentist is working in the back end of the lab, doing everything. You don't know, you're wasting your chair side time. Your 8 hours are precious. Make every minute of that count. You are not perfect in everything. But if you are not perfect in everything, I don't expect you to do everything. So the best is to delegate wherever you can. जो काम आप best नहीं करते हैं, उसको delegate कीजिए. It is a multi-speciality, multidisciplinary world. People will ask you, आप ये नहीं करते हो? We get offended. Take it on our ego. अरे बॉस, उनको बोलो गायनी वाला स्किन का काम करता है, कि स्किन वाला मेडिसिन का करता है, कि मेडिसिन वाला सर्जरी करता है. Tell them these are different specialties. We have different MDs. These are different specialties. If you are not comfortable, you are not happy, it is not your niche, it is not your love, it is not your like subject, don't do it yourself. I mean, delegate to associate, to a visiting, to a consultant who will do a better job, who will ensure a better compliance, who will ensure a better and a happy and a satisfied patient. But we try to do everything because हमारा नाम है क्लिनिक पे. पेशेंट को ऐसा नहीं लगना चाहिए डॉक्टर को कुछ आता नहीं. अरे if you present the story, हम तो हरफन मौला है, ऑलराउंडर है. I can play from number 1 to 11 in my team. You can't. You still need 10 more players in that team of 11. You need to know. I'm just giving an analogy of a cricket team. So don't try to do everything yourself, because time management is equally vital in making profits. Dr. Prateek mentioned in the beginning, Rajiv mentioned in the beginning, I've written 8 books. Out of that, 1 book is on time management. All of those books are available on Amazon.com, not in India yet, and they were priced higher. So these will be coming in the Indian territories, most likely by next month, or maybe April max. By April, and they'll be launched in India. Because if you order from Amazon.com, $47 cost plus the $47 or $45, you can say duty charge, it'll land up with you in close to $100, which is an expensive buy. I won't recommend you. So they are available online since May 2020, but I will still not recommend you to buy it, because they will be available shortly on Amazon.in. So coming back, time management is one of my favorite subjects along with costing. So if you are wasting your time in doing everything, in trying to do everything, you are actually making a misuse of your talent. You're not meant for this. You need to do things only which give you productive output, which give you productive income. Then examine the way you purchase materials. People see offer, किसी store में गए, किसी experiment में गए, we actually buy in bulk, thinking इतना तो लग ही जाएगा, इतने patient तो आ ही जाएंगे. Look at the cost factor only, which is a wrong approach. We don't need to do that. We hardly explore that option. And many times bulk के लिए बहुत बारी हम लोग local बंदे के साथ कर सकते हैं. He can give you a good discount, good deal sometimes, but then for that your relationship has to be cordial with him. Then don't overstock, except those are in tier 3, tier 4 centers जहाँ पे किसी को बोलते हैं ना डीलर को सामान को आने में टाइम लगता है, they can do it. But otherwise, if the things are being delivered to you next day or maximum 2 to 3 days from outstation, why do you need to, you can say, fill your cupboards with that? What happens? You are not monitoring those things yourself. I'm not sure whether the LIFO or the FIFO system is following. Last in, first out, first in, first out. Whether that is being followed. काम करते करते खत्म हो गया, स्टाफ को बोला लेके आओ, वो ले आया न्यू मैन्युफैक्चर डेट, जो ओल्ड मैन्युफैक्चर डेट वाला था वो पड़ा था वहीं पे. Yes, if you have a system of that, it's wonderful. But वो क्या होता है, नई वाली चीज खत्म होगी, पुरानी चीज एक्सपायर होगी. जो बल्क यूज किया था वो खत्म ही हो गया लॉजिक. So don't plan for a disaster. And obviously storage में theft का, spoilage का, obsolescence का, खराब होने का, temperature control, all these things matter a lot. Then one of our favorite topics, discounting. So if you value your charges, value your time, value your skill, don't offer any discounts. We all want to do it, or the patients want to take it. Sometimes people say, कोई बात नहीं यार, लाख का काम है, 20,000 डिस्काउंट देगा, 80,000 तो आया. You didn't you didn't calculate the cost. You don't know what is your GPM, what is your NPM, the gross profit margin and the net profit margin. The gross profit margin is your direct cost. The NPM includes direct plus indirect cost, which is the hidden cost, which you are not aware of it. So those things, discounting thing, even if you are offering, can be overused sometimes. And wo value kam ho jati. Don't undervalue yourself. And then metrics, trackers and metrics. Always track how many new patients, how many actually getting converted, what is the contribution of those new patients to your revenue, what is the old retention percentage, and many more. There are total 350 kind of tracker questions that I give to people. Yes, 350. Yes, you will say there are too many, but then everything does not need to be, you can say, applicable to everyone. There are a few things which are applicable to someone. There are many things that are applicable to someone. There might not be actually a very few things which are applicable to only a few individuals. They may be having the system as perfect already. So cut that out. What is not working for you? Overstaffing, over usage of material, over storing of materials, using cheap materials. You can say not having good consultation and not having good conversion rate. Track all of that, and that is the way you can actually grow it. People always say, sir, maths छोड़ा था इसीलिए तो medical लिया था. Lekin I am back to haunt you once again with your mathematics. Mathematics, what cannot be measured cannot be seen. If you can't measure, you can't know, you won't know whether you're growing or not. So we all need to know the type of the costs and their role in profitability of the clinical practice. to build up a profitable dental practice. What exactly are they? We all know about the fixed costs. So these are those expenses. We can say patient I and I COVID में हुआ ना, 0 patients थे, लेकिन fixed cost फिर भी थे. रेस्टोरेंट को भी जैसे अपना रेंट देना पड़ता है, अगर आप भी रेंट पे तो आपको भी रेंट देना पड़ा. चलो शायद बहुत सारे लैंडलॉर्ड्स ने एडजस्ट किया, बट व्हाट आर द फिक्स्ड कॉस्ट? They include our salaries, EMIs, and your salary, rent, electricity bill, water, sewerage, house tax, professional tax, EMI, biomedical waste, corporation waste bill, gatekeeper, chowkidar charges, and many more, or maybe less from this list. These are the fixed charges which you have to pay every month, whether you have even one patient or not. If you are running a practice, of course, I don't presume that you don't have even one patient that way, but I mean to say that even if you don't have one patient in a month, as we had during COVID, we'll still need to pay these. Then these can be time limited sometimes, they can be fixed for a certain period. The second cost is the variable cost, which changes with the level of production or the change in output. You have more patients of the lab, your lab increases. Because along with that, your production volume is increased, so your variable cost also increases. So in COVID, there were no variable costs actually, especially in the first 3 to 4 months. We never had an inflated electricity bill because everything was coming, you can say, average in those regards. Our minimum bills were coming for our electricity, for our water and sewerage or anything else. And even our lab bills were 0 because there were no patients. The dental material bills were 0 because we already had the material. We never offered anything. So many of the things actually from the fixed also became, only a few became 0. But the variable thing was totally 0. So this is the way things can actually can change. The more the number of variable costs, that does not mean a bad thing. That actually means you have more practice numbers. You have more growth in your practice. You have more revenue coming in. So revenue आ रहा तो फिर आप variable cost तो high होगी ना. So knowing your cost is one of the, you can say, strictest roadmaps to a profitable dentistry. So what are the costs in dentistry? So even if say you are the best dentist in town, आपको भी cost तो पड़ेगी ना, आपको free तो होगा नहीं. So as I said, you have to identify your leaking profit bucket. अब example देता हूँ आपको composite की. What are the costs involved in a composite restoration? Just pay some attention to the slide and you will know what I'm talking or what I was talking about in the past half an hour. So number 1 is the direct cost. Cost of materials, cost of the chair side time for the assistant, for you, cost of your skills, cost of your rubber dam sheet if you're using, cost of your bottled water. I hope you're not using the normal filter water. But these are the direct costs, some of the direct costs that you're incurring. Okay, so let me show you a few indirect costs. The cost of your handpiece bearing, rotor I mean, or even the micromotor if you have used for polishing, of course. Then the cost of your AC, lights, fan. What is that contribution to the electricity bill in the 1 to 2 hours for that procedure? The cost of your assistant, more so if you're doing a 600 dentistry with 2 assistants. Say, then the cost of depreciation of your equipment, because your equipment, whatever you're using, is wearing down in value. Then cost of your bulb of your LC gun or LED, whichever you're using. It is also, you can say, it will need a replacement after some time. So where will be the cost coming from this? If you are we all look at just number 1 of the direct. Whenever you look at even the direct of the other 4 or 5 costs. This is just an example. The costs are actually more than this also. Indirect तो छोड़ ही दो ना सारे. Direct में भी 5 में से 1 देखिए हम. Composite कितने का लगा? That's it. So these are 5 things. And trust me, this is not over. Then we have some semi-variable costs which are incurring. Cost of your suction running, cost of your chair bulb light, cost of your maintenance of your chair, cost of your instruments bought for composite, especially the non-sticky or the Teflon coated or whatever, or the imported ones. Then the cost of sterilization of those instruments. I believe all of us are doing it. And trust me, this is still not over. There is a COVID-19 costing as well. The cost of sanitizer, cost of PPE kit if you are using, cost of scrub and overall if you are using that ways, cost of patient drape, the cost of shoe cover and accessories, the depreciation of your extraoral gadgets which have you bought on the recommendations in the first 6 months, HEPA filters, extraoral suctions, defogger, or whatever you bought it, and most of them are actually biting the dust in a corner of your clinic. Trust me, cost of storage and cost of shelf life, and you can say cost of space are also the costs which we are incurring. So as I said, there are 27 kinds of costs. You already saw 16 already, or rather you can say, 21 already, 555 and now 6 in this COVID-19 added. So yes, all will not be applicable, but out of these 21, at least 12 will be applicable to you. Half, आधी तो applicable होगी ना कम से कम. If they are not applicable to you, then you are actually not doing, you can say, good quality dentistry. That is the simplest answer I can say. I have still not added, 21 में 5 और add कर लो, 26, cost of expiry, cost of your storage, cost of pilferage, cost of shelf life, which is different from your storage cost of deterioration, which is, you can say, different from expiry. Obsolescence इसको बोलते हैं हम लोग. So these are all costs. हम खराब हो जाते हैं, we throw it away without have the proper knowledge of things to buy. और ये सारी costings होने के बावजूद we look at the direct cost and we charge as per that, उसमें भी low. तो फिर profit कहाँ से आएगा? फिर वो मीमोडोंटिक्स जैसे ग्रुप थ्राइव करेंगे ना, वो कहेंगे डेंटिस्ट्री है ही घटिया प्रोफेशन. That is the way we actually look at it, because we have been fed this thing. नहीं यार, डेंटिस्ट्री में तो है ही नहीं है, देखो बीडीएस में सीटें खाली जा रही हैं, लोग इंटरेस्टेड इन डेंटिस्ट्री में, because we have made our own life hell via our own ways. We are not ready to change. We are not ready to listen only. We waste our time on a lot of social media in the day, but we will never listen to a useful thing. Even if we listen to it, we will not apply it. And even if we apply it, we will not track it. And if we track it, will not, you can say, bring out a desirable change. Marketing में 3 phenomenon use होते हैं, EACR: execute, analyze, correct and repeat. जैसे विराट कोहली को पूछा गया था ना, क्या करते हो? Eat, sleep, exercise, repeat. Eat, sleep, exercise, repeat. उसी तरह EACR: execute, analyze, correct and repeat. Some things will work for you, some things will not. So this is the way you need to understand. I'm not going to give everything to you in these 130-40 minutes. But what I'm going to give you in this time is a mindset to have a look at this aspect of your clinic from a different perspective. ताकि आप सोचो, profitability is not about only your patient's revenue and patient's charging. बहुत कुछ आपके हाथ में है. Costing, which you don't know only. Overhead costs are everything that you don't put into your pocket. जिसको हम लोग indirect costing बोलते हैं, जिसको हम लोग hidden costing बोलते हैं. कुछ hidden costing मैंने आपको दिखाई, 26 तरह की cost मैंने आपको दिखा दी. 26 में से at least 12-13 आपको applicable है. नहीं है तो I told you, it is you're not doing a great dentistry. So achieving a better bottom line profit, or you can say a good net profit, will need a gross profit first. कि पहले आपके charging ठीक हो. Gross profit का simple formula होता है revenue minus your direct cost divided by revenue into 100. ठीक है? तो अगर आपका gross profit margin ही 60 आ रहा है, तो net तो automatically 30-35 आएगा. So that means every 100 rupee coming into your clinic, you're taking home 30 rupees. And 30% is not a profitability level for dentistry. You need to have your NPM in the range of 50 to 55%, minimum 45. So if you are not doing it, if you're not carrying home, you need to measure. हम लोग सिर्फ डायरेक्ट बिल देख के बड़े खुश हो जाते हैं. लेट्स से 2 लाख कमाया है, इसमें सैलरी दे दी, लैब बिल दे दिया, और कोई मटेरियल का बिल दे दिया, एंड कोई और कुछ क्लिनिक की EMI दे दी, एंड वी फील यार फिर भी 1 लाख बच गया अपने पास. We never calculated the other costs. We just calculated the direct cost, just 4 or 5 of them. So we need to have a better sense of our fees and our costs. If you have to, you can say, roll your ship of clinic in a better way. So I know many of you would be having this feeling कि मेरे हाथ में तो बहुत भरा हुआ ग्लास था, लेकिन अब ये टूट गया है. But this is the way thing works. If you have not been aware of the costing part, welcome to the reality. This is the actual reality of our practice, which many of us are not aware of actually. Now, we get a question in the clinic. अब कॉस्टिंग से आते हैं प्रॉफिटेबिलिटी वाले पार्ट या प्रैक्टिस वाले पार्ट। इसी पीपल come to us, ask for guarantee of RCT, guarantee of crown, guarantee of a restoration or a filling, like kitna chalega. So what do you do actually? Some people will get offended, some will take it on their ego, and some will reply back badly. What do you do actually? I always advise, पहली चीज तो ये है कि अपना टेम्पर लूज नहीं करना. Never fret or frown. Use a controlled but a polite tone. मेरे डैड हमेशा एक चीज कहते होते थे, I haven't given introduction about my dad since it's a practice management session. My dad has been teaching me, instrumental in teaching me a lot of clinical part of finance. He was actually gurus of the gurus. He was a retired banker, but 50% of pre-2005 era, all CA students are my dad's students. So he has been a teacher to so many CAs of Punjab. So he was a very learned man. He passed away in June 19. 2.5 plus years back. So he used to say, he used to tell one thing very fond. He said, play lawn tennis. Now, what do you mean by that? He said, when I tell play lawn tennis, I mean that you learn the concept of lawn tennis. What does lawn tennis say? Lawn tennis means throw the ball in others' court. वापस उधर के कोर्ट में फेंको. Let the patient decide. So if the patient asks you, कितना चलेगा? Some people have this approach. चल गया तो चांद तक, ना चले तो शाम तक. That approach can be better worded in a way. If you maintain it well, it will serve you 5 to 7 years. If you don't maintain it well, शायद 5-7 दिन में निकल जाए. Although you know कि 5-7 दिन में निकलेगा तो कोई technical failure आपके end पे है. But you have covered both the ends very, very fantastic. Always throw it on the patient's part. I remember one of my good friends in Australia. He used to say, हमारे पास पेशेंट अगर हफ्ते बाद भी आ जाता है ना कि फिलिंग निकल गई है, he says, doctor please check my tooth. I think I must have eaten something wrong कि फिलिंग निकल गई. और यहाँ पे the culture is reverse. लोग आएंगे बोलेंगे, for example, patient coming to you, डॉक्टर फिलिंग कराई थी, चली तो है नहीं, निकल गई. कब कराई थी आपने? 2 महीने हुए होंगे. And if somebody of you replies, सर कोविड को 2 साल होने वाले हैं, पिछले 2 साल में तो आप मेरे पास आए नहीं, 2 महीने कैसे? नहीं डॉक्टर साहब 2 महीने हुआ, मान लो मेरी बात. If you have a good record keeping, you will check into your record. Sir, your filling was done in May 2019. It is close to 3 years and you are saying 2 months. नहीं डॉक्टर साहब गलती लगी होगी. सर मैंने आपको पहले बोला आप कोविड में नहीं आए मेरे पास. आप कोविड में आए हो? नहीं. अगर आप आए होंगे तो मेरे पास आपका वैक्सीनेशन सर्टिफिकेट होगा, अगर आपने वैक्सीन करवाया हुआ तो. Again, this tells you 2 things. You need to have that part of record keeping and vaccination certificate if you're doing it. Get my point? Small little things which make a difference overall. But if somebody says and tries to do it and you don't have a record, you'll fall in that trap. But this is the way you can always convey. When you have said this thing before or you have conveyed these things before, ये पेशेंट ऐसा आपके पास कभी आएगा नहीं कि 2 महीने हुए फिलिंग दोबारा कर दो. You know it. And for the crowns, मेरा फंडा बिल्कुल डिफरेंट है. As I told you in the disclaimer slide, मैं डिफरेंट तरीके करता हूँ. I have been using it ever since my lab started it. I pass on the lab warranty to patients. All my patients जो वारंटी वाला क्राउन लगवाते हैं, 2 साल, 5 साल, 10 साल, 15 साल, whatever. And it does not come free of cost. The patient is told that the procedure will have 10%, 15%, 20% charges. Those are the file costs or whatever the procedural charges or whatever replacement charges or the clause charges, whatever name you want to give it, it is your choice. 10% for metal, 15 for PFM, 20 for that. Usually most of that is good enough for me to cover my direct costs. But then we need to know that this is a great practice builder tool. You do it for free, the lab might do it to you for free. But you need to understand that the patient needs to be given a cushion in that regard, that this will serve you for long. In case it does not, you have a rider of 10%, 15%, 20%. Again, this is my philosophy. You're free to differ from it. But over the period of past 13 years, 2008 or 9 when I started it, I am actually having a better time in my practice ever since then. My patients are more relieved and more relaxed. They know it. कि अगर टूट गया in the warranty period, we still have to pay 10, 20, which normally does not happen. But this is the clause because this is my clinic. I'll settle the rules myself. I'm the boss. I will decide what works for me, what works for the patient. So you need to know in this regard. People will say, कौन इतने कार्ड संभाले क्या करे? If you're doing record keeping, आपको सब काम मुश्किल लगेंगे. But then you need to make a balance. Practice build करनी है. This is a kind of an internal marketing thing. Lab आपको facility दे रही है, आप नहीं pass on कर रहे हैं, तो you are actually losing out on that one opportunity. Yes, I do not give any warranty guarantee on crowns, restorations, or any other procedure done in my practice. I don't give it. Even on crowns, I am not giving it. I'm just the facilitator of passing the lab warranty to my patients, acting as a mediator and charging my procedural costs involved in the procedure. And usually 15 to 20% is a good margin for me to cover my procedure and my time costs. And because I have एक मेरा अपना फंडा है, I don't want to earn the same. I don't want to earn the profit from the same patient twice for the same procedure. एक क्राउन जिसके लिए मैं कमा चुका हूं, मैं अगर वो टूट गया because of any reason, because of genuine reason also, पेशेंट का एक्सीडेंट हो गया, कुछ हो गया, या whatever reason, if it is there, I just want to be covered for my time and for my materials. That's it. I don't want to earn a profit from him again. The same thing, lab is obliging by repeating it free of cost. So why do I need to do it? Again, you want to carry home this funda from me or not? Your choice. I leave it to you. But I'm doing it in that way because it is one of the ways which has helped me actually give more satisfaction to my patients, at least in the mental aspect. So the Nobel Prize winning psychologist Daniel Kahneman said once that every waking person will have 20,000 individual movements in a normal day. So each movement may be a few seconds, but each of that is important because people tend to absorb and reflect the atmosphere and emotions around them. Again, that is where the clinic ambience comes in. I don't recommend that the clinic ambience need not be or should be flashy interiors for everyone. If you can afford it, perfectly fine, go ahead. But it should be a decent looking one. पर्दे फटे ना हो, blinds मुड़े ना हो, sofa फटा ना हो, पर्दे मैले ना हो, like that. Those things should be there. I always recommend male dentists to take their female, of course, spouse to the clinic, even if she's a dentist or not. जो कोनों में dust वो ढूंढती है ना, कोई नहीं ढूंढ सकता. So always take your spouse and she'll tell you what all things to mend in your clinic. Trust me, whatever environment you are giving to the patient is going to absorb those things also. It is a part of the patient satisfaction also. For example, aroma, as they say, clinic में अगर monomer की smell आती रहेगी, spirit की smell आती रहेगी, the patient will not feel very comfortable. He'll feel nauseating. Some people will not relish that. They said, clinic तो अच्छा लेकिन smell बहुत आती है वहाँ पे. I can't go it. Although it is a medicinal smell, but some patients will still not have that. So they absorb that emotion around that. So the master key to patient satisfaction is to have a magic ratio. And that happens between your clinical team of your assistant, associate, or whosoever you have along with you and your patients. So it is, you can say patient satisfaction का ना कोई tracker या metric नहीं है कि आप measure कर ले on a scale of 1 to 10, how much are you satisfied? Patient can give you, of course, his response, but you can't measure it yourself. But yet it is a proxy indicator. If the patients are getting their repeat work done from you, they're sending you referrals, that means you are going high on a success degree. If they are not, अगर वो अपना भी pending काम करवाने नहीं आए, it tells you that also. मैं इसकी बहुत छोटी सी एग्जांपल एक दूंगा. Somebody walks into your clinic with a, you can say, Carious 3.6, and of course, don't bypass the pre-operative X-ray or other investigations. But let's keep them aside for a moment. You see it and you see it an ideal open and shut case of a root canal in a 3.6. Suddenly your focus shifts to patients 4.5, 4.6. What do you find? A missing tooth in 4.5 and 4.6. So what is the commonest human approach? The Cadbury ad, Man mein laddu phuta. we'll all have that mindset. Wow, यहाँ पे तो root canal कम मिलेगा, यहाँ तो implant, bridge. We start weaving those things in our mind. And that is where actually we falter sometimes. The patient has come to us for 3/6, the chief complaint. We try to focus our attention on this. So you need to understand, you have to treat the patient 3/6 with the 3 E's: effectively, efficaciously, and efficiently. Effectively, efficaciously, and efficiently. And then, as a part of your duty, before the patient leaves, do an alternate I&E. I&E bolte income and expenses. The alternate I&E is information and education. Tell the patient that hanji aapki ye missing hai, tell the side effects, do a proper consultation, and now let the patient be pulled back to you for your excellent work done on 3/6. But if after 3 months, 6 months, you give a reminder call and the patient makes excuses and you don't get a good response, or you can say a delayed response, ya talne wala response, so you know it that the satisfaction level was never achieved as per the patient's desire. और उसमें पैसे की बात नहीं आती है. आपने मांगे पैसे, फॉर एग्जाम्पल 1000 rupees, द पेशेंट पेड यू 1000 rupees. आपका कोई इशू नहीं है, आप उसको कॉल कर रहे हैं आफ्टर 2 months 3 months फॉर अ रिमाइंडर, फॉर अ चेकअप, द पेशेंट इज नॉट कमिंग. तो उसमें प्राइसिंग तो है ही नहीं इन्वॉल्व, बट द पेशेंट इज नॉट कमिंग टू यू. व्हाट डज दैट मीन? ही वाज नॉट सेटिस्फाइड, ही वाज नॉट हैप्पी. अब इसमें प्राइस कहां से आया? प्राइस इसमें यहां पे आया, द पेशेंट फील्स कि जितनी मैंने कॉस्ट पे की, मेरे को उसकी वैल्यू नहीं मिली उतनी. अब वैल्यू मेजर करने के होते हैं यार, पेशेंट के स्टाफ को बोलने की तमीज नहीं. पेशेंट के स्टाफ ने कपड़े गंदे पहने थे, डॉक्टर को खुद के पास टाइम नहीं था, एट टाइम दूसरा पेशेंट भी ट्रीट कर रहा था ऑन द सेकंड चेयर, और मेरी बात ध्यान से सुनी ही नहीं उसने, और मेरे को कोई इंस्ट्रक्शन नहीं दिए, मेरे को कुछ नहीं किया. मैं उसको बोल रहा हूँ इस 3/6 को ट्रीट करो, वो मेरे को इस पे बताने में लगा हुआ है. ऑल दोस पार्ट्स. That is why I said at the end of the procedure, as a last process, in do the alternate IND. So the satisfaction can be because of various reasons. काम अच्छा किया लेकिन मेरे को 2-2 घंटे हर सेटिंग में वेट करवाया. He actually doesn't have any record of मैंने पिछला काम कब करवाया था. Small trivial things can actually become a catalyst for patient satisfaction, as you can say inconsequential thing for you, like a waiting time, as I told you in the beginning. So David Masler एक यूरोपियन हार्वर्ड प्रोफेसर है. अब यूरोप में पहले अमेरिकन थे, ऑफ कोर्स अमेरिकन राइटर भी हैं. So he's given one satisfaction formula, जिसको हम लोग फर्स्ट लॉ ऑफ सर्विस भी बोलते हैं. It says you can measure satisfaction by this tool. What is that tool? It says S is equal to P minus E. Satisfaction is equal to perception minus expectation. The patient comes to you via certain expectation. किसी ने रेफरेंस दे दिया, यार चले जा डॉक्टर बहुत अच्छा है, उसने आपकी एड देखी, मार्केटिंग एड, whatever. Of course, we are legally allowed to advertise as per the DCI revised regulations, but in ethical way, of course. तो उसने आपकी एड देखी या आपके बारे में सर्च किया गूगल पे, आपके गूगल रिव्यूज देखे, उसके बाद फाउंड नहीं यार डॉक्टर तो ठीक लग रहा है, तो he made a certain expectations about you. Now he's taken an appointment, walked into your practice, received a treatment from you, and what you gave him treatment, ऐसे भी और वैसे भी. ऐसे भी means treatment wise, वैसे भी means the internal marketing factor joint. And what does that joint include? Your clinic ambience, your staff's behavior, your record keeping, your appointment thing, your diagnosis, your treatment skilling, multiple factors give the वैसे भी part. So अगर ऐसे भी और वैसे भी मिला के what perception we found for your practice, if the P is positive or more than E, the resultant S would be positive. But if he says यार मजा नहीं आया, ऊंची दुकान, फीका पकवान, रेट इतना ले लिया, काम भी इतना अच्छा किया, या देखो ये फीलिंग है अभी ऊंची, आई एम नॉट एबल टू ईट फ्रॉम दिस साइड, ना कोई फॉलो अप किया, ना कॉल किया, ना बुलाया, इमरजेंसी बोलते रात को फोन इनका स्विच ऑफ आता है, इनको फोन करो तो इनका असिस्टेंट फोन उठाता है. स्मॉल लिटिल थिंग्स. द पेरेंट सेज नहीं, मजा नहीं आया, दैट अप्रोच. So if you want to exceed the expectations, you have to give good perceptions. The good perceptions will not come only by treatment. but by a host or a combination of your internal marketing factors as well. So if the patient perception exceeds expectations, the resultant S would be positive. But if the perception does not meet the expectations, there will be a resulting dissatisfaction. So you can say you can always exceed those if you provide good quality treatment coupled with a good quality service. And service usually includes everything. And service is what we are actually doing. We are not in a goods selling industry. We are in a service providing industry. We need to understand that part. So patients use the comparisons of these expectations actually to recognize the difference amongst their competitors and someone you can say to make a final choice कि वो dentist के पास जाएं या वो dentist के पास जाएं. So this is the way actually people do it in that sense. So play a cash ball, as David Master says. So then the next question comes is how to make your dental practice grow. What are the fundamentals involved in that? There are 4 basic principles: footfall, conversion, upgradation, and retention. And those principles have to be obliged with carefully. So footfall will ensure that there are people walking into your practice. Conversion means that you're doing a good consultation and they are actually getting converted for treatment. And when they're getting converted for treatment, the primary aim is to create a host of or a bunch of hugely satisfied patients. And once you create those patients, you will actually make them your loyal patients. And once they are loyal patients, you can upgrade them to a higher form of treatment. Auntie, आपने पिछली बार PFM लगवाया था, अब आप मेरे घर पे metal free लगवा के देखो. This is a better job. This is a better work. This gives you better smile. This gives you better look, aesthetics, finish, whatever way you want to promote it. And then retention of your patients. Sometimes we feel भाई इसके मुंह में सारा कुछ तो कर दिया, सारे क्राउन्स कर दिए, सारे फिलिंग कर दिया, अब ये पेशेंट मेरा किस काम का? We try to have that kind of an approach in our practice, which is actually a wrong approach. You, as I said, जो नया पेशेंट आएगा उसको इस सारे पाथ से होके जाना पड़ेगा. इस कन्वर्जन से पहले उसको कंसल्टेशन करनी है, अपग्रेडेशन से पहले उसको आपका हैप्पी सेटिस्फाइड पेशेंट बनना पड़ेगा, आपका इंटरनल मार्केटिंग सिस्टम पसंद आना पड़ेगा, आपका वे ऑफ वर्किंग पसंद आएगा, आपका सारा जो भी आपने क्रिएट किया तामझाम वो पसंद आएगा, and then he'll become your loyal patient. If you're losing these retentive and old patients just for, you can say, trivial reasons, you need to understand that you are actually faltering somewhere or the other. So footfall, as I said, getting patients inside your clinic. The conversion means actually getting the patients do that treatment. And for upgradation, already converted patients to higher form, and retention is mainly for existing old patients or happy patients, or also I call them, if they're very happy patients, I call them the brand ambassadors of your practice. Vince Lombardi said once, it takes months to find a customer, but seconds to lose one. So you need to understand what actually you want to do. You want to retain your old patients, or you want to just keep hoping and waiting for new patients. Somebody who's having a decent mix, an average, we can say ratio in a month is 75-25. If you're doing 100 patients in the month, 75 of them should be old and 25 should be new. That is again a decent ratio. Can be plus or minus depending upon the location of the clinic. A main road would always have more patients than 25%. Old, you can say inside not proper access having patients, maybe having a lesser percentage, but that is the ideal percentage, but that can vary, as I said. So what are the retention tips that I can give you? So for retention, you can keep in touch with these old patients. As I said, doing a free follow-up for your brand ambassador patients, sending them social media message updates on their WhatsApp, on their message, but after a prior permission from them. Don't bombard their WhatsApp or inbox with any social media messages. Then sending e-cards on birthdays or anniversaries, of course, if you want. This is one of the ways. I don't do it, but many can do it. They have those columns of birth and anniversary on their patient registration form, but I'm just telling you the way if you're doing it. Then sending e-newsletter if you have any publication for your clinic, or keeping follow-up visits after every 6 months that I told you already before. Patient record software can actually help you track appointments, patient records, and payments. It saves you time and paperwork a lot. If you're still sticking to manual mode, think of shifting to the digital way. Not exactly, if you don't want to invest in a software, shift in at least a basic Excel format for your recording purposes. It'll help you to recall and revisit your patients in a better and a easy and a transparent way. Then differentiate your service. Always keep on adding new things, new services to your portfolio, to your clinic, you can say armamentarium. It can be gadgets, it can be services. It need not be by you. It need not by you. It can be by a visiting consultant also, by an associate also, but expand your services, keep on differentiating, because this is one short way of growing your practice. Because normally वो बोलते ना, which services are in demand, the in thing today, always do that. And then keep on changing a little bit internally, a few things every now and then in your practice. Maybe the clinic paint, maybe the curtains, maybe sofas, maybe the furniture, anything. 2 to 3 years, 1 or 2 things should change in your practice. And most commonly the paint, the blinds, the curtains, or maybe even the waiting area shoes or slippers if you're doing it, any magazine stands, your newspapers, your magazines should be replenished every now and then. So always keep on upgrading so that the patient has that feeling of freshness being induced into your practice every now and then. He doesn't feel lots of 10 साल पहले जैसे आप थे अब भी वैसे दिखता आपका clinic. This is not a compliment. This is actually a comment. So said in a sarcastic way. So you need to understand that whether you are doing it or not, you need to decide. And of course, I'll be giving you a few patient satisfaction tips as well. Now that we have discussed a lot on internal marketing and patient satisfaction being in sync with each other, and of course, what is the price connection with them? That link you would be able to join in the end, surely. So patient satisfaction is all about improving the patient experience in clinic. और अगर patient का experience clinic better रहेगा, the patient relishes coming to you, it is a good factor for patient retention. And something as trivial as pain-free dentistry can be one of the biggest you can say a biggest a puller for the patient कि हाँ ये डॉक्टर दर्द नहीं करता है, ये डॉक्टर वेट नहीं करवाता है, डॉक्टर काम तरीके से करता है, ये डॉक्टर सारा कुछ पहले समझाता है, सारा कुछ पहले बताता है, and then does it. A few little things and these all make a big difference, because ultimate aim for every one of us is to improve the patient experience, and that is what matters to, and that is what it should matter to every one of us. So let me give you a few, you can say, tips to improve patient satisfaction, how we can hit the bull's eye or improve our magic ratio or the magnetic ratio. Thereby we can enhance our patient satisfaction and of course the retention part. So the first tip is pull, don't push the treatment options. I gave you an example of 3, 6 and I'm missing 4, 5, 4, 6. Always let the patient be pulled towards you for your work done in a 3E format, efficaciously, effectively, and efficiently. So let that patient be pulled back to you, because you have done your duty of informing the patient that you have this missing tooth, and these are the side effects of a missing tooth. The supraeruption told to the patient in his language, the mesial migration, or whatever periodontal problems, whatever is associated with that, you need to convey that to the patient absolutely clearly. So then engage your patients. Some people have a habit of not telling anything and they are introverts. You may be a big introvert in your personal life, but change that image in your professional life. You need to talk, you need to involve, you need to engage the patient. You need the patient to be in mentally sync with you. If the patient is not in sync with you, you will not be able to actually get a grasp of what his mind is thinking, and what you are going to say and what he's going to perceive will always be a mismatch. Then pre-frame and ask permission for every step. Even for the normal simple X-ray, IOP or RVG, whatever you're using, always take a prior permission. Do not take things for granted. It's patient's body, patient's teeth, patient's jaw. You need to take a verbal consent. Of course, छोटे मोटे कामों के लिए आपको written consent नहीं चाहिए, but you still need to tell the patient about the written part. Then always be short and sweet. Story weaving is an excellent thing to be done in the clinic. but don't actually overdo it. Once we start overdoing a few things in our practice, trust me guys, people start getting bored. उनको लगता है यार जो काम के लिए आए हैं पहले वो करिए, आप बाकी काम के लिए क्या करना. So be very short and sweet. Do weave stories, do tell them incidents, do use anecdotes, but don't overdo any of those things in your practice. Then, as I said, using stories, be persuasive, eloquent, and expressive. Patients will always have an excuse. You should always have an answer. They will have an excuse to not do the treatment. You should always have the excuse of telling them the reasons to get that treatment done. For this, the best, three times best way is role reversal and role rehearsal that I always promote. Role reversal is something that, for example, this is applicable to those guys who both the spouses are dentists. So they can do, one of them become a patient and the other can become a consultant. Ask the patient, ask the dentist about the questions. And after one is done, you can interchange the roles. The other becomes the one who was dentist before, can become the patient and vice versa. And thereby you can do it. That ways you will be better equipped to handle the patient queries. You can do even if not the spouse, you can do with an associate as well. Or the role rehearsal part can be that you actually prepare yourself, thinking, keeping yourself in patient shoes. What can be patient questions actually? So what should I be prepared for? It's not always about the pricing and the guarantee warranty part. The patient has longevity questions also. The patient has technical questions also. You should not be found yourself short on these aspects. So always respect your patient's decisions happily. You know that the patient can get an implant done for a missing 4546, but the patient chooses a metal bridge. तो the commonest approach is तो हमारा क्या होगा, तो हम कद्दू की तरह मुंह बना लेंगे. Oh shit यार, इम्प्लांट वाला पेशेंट मेटल का ब्रिज लगवा गया. Oh my god, वो कद्दू की तरह मुंह नहीं बनाना है. Be happy, accept the decisions happily. The patient has still made a decent choice. It is not a bad choice. Tell the patient the pros and cons of the metal bridge, about the visibility part, and of course those aspects which are associated with it. So just explain the patient those aspects, and then even after that the patient says I'm fine with it, go ahead and respect the patient's decision happily. So create an environment of I, me, and myself. Create an environment of caring. The one thing which we all should not do in the clinic is I, me, and myself syndrome. मैंने ये केस में ये कर दिया, मैंने ये केस में ये कर दिया, देखो हमने पेशेंट हमारे पास ऐसे आया था, हमने ऐसे कर दिया. But the patient has already chosen you amongst the available 10-15 in that area. Everybody of us can vouch for this fact कि हम लोग सब एक एरिया में मिनिमम 10-15 डेंटिस्ट बैठे हैं इस वक्त. Courtesy, big thanks to the Dental Council of India. We are all minimum 10-15 in an area. Not knowing surely about tier 4 or tier 3 cities, but yes, in tier 1 and 2, the number can be more, if not less. So if the patient has chosen you, the patient knows that you are the best amongst all of them. You don't need to put that point vehemently across and be carried away in that air of, you can say, pride. Don't do that. Just create an environment of caring that whatever you are offering is for the patient's benefit only, and you will be always taking care of the patient in that regard, so that the patient doesn't feel that he's left out. So another Harvard professor mentioned one thing, Theodore Levitt. He said, products are consumed, services are experienced. Guys, we don't sell products. We sell services. So if the patients are experiencing your services in a better way, trust me, they will always be your retentive and retention patients. Nobody minds spending the money if it is done with a needful approach, with a mindful approach, with a correct approach. So we have to create that environment of caring where the patient feels actually not left out anywhere. So even if the dentists in your area are not good enough quality wise, you don't have to be andho mein khana raja. You need to understand that you have to create your own benchmark. Your primary competition is with you, yourself of 2021. What you were in Feb 21, you have to compare with yourself of Feb 2022. How much have you grown? Not practice wise, but PD wise, personal development wise, work wise, skill wise. How have you done? Which materials are you using better? Which services are you doing better? Which you can say things you were not doing before, but now you are doing in a better way. You need to understand those things and create your own benchmarks. Then work with patient schedule. When you are giving an appointment, always honor those appointments. Then I already mentioned, create an excellent follow-up system for your brand ambassador patients. Do not let them feel belittled that your follow-up system, or you don't have that system where you actually you say one thing and do another thing. You are not caring in that regard. That should not be the case. Then the clinic decor. People ask me, does the decor really matter? Yes, it does matter. It should not be a flashy interior, but what you can do is that you can at least have a decent looking, sober looking premises, if not a flashy one. Yes, I'm not against it. If you can afford it, go ahead. But that should not be the only thing, that your decor is really flashy, but your service and your treatment skill part not up to the mark. Then calling back. People have this ego problem. हम डॉक्टर हैं, हम थोड़ा कॉल करेंगे. पेशेंट की जरूरत है, पेशेंट अपने आप कॉल करेगा. Call rates in India are the cheapest in the world. So if we can't even handle, if we don't want even our staff to call back, or even ourselves we are calling back, in the initial years of practice, I always encourage that the dentist should himself or herself call back first. Once you're settled, you can delegate this job to your staff. Always call back, always take a follow-up, always ask after a procedure how you are doing. Are you fine? If you face any problem, don't worry, we are there. Please feel free to connect with us. We'll surely get back to you. Even if the phone gets unanswered for a couple of times, we'll get back to you. So then waiting time, I've already told you, ideal waiting time should be 5 to 10 minutes, not more than that. But the amount of time the patient spends in the waiting area is actually plays a big role in patient satisfaction. So we need to know that if the dentist is giving the appointments himself first, he, or through the receptionist, of course, he needs to make sure that he follows a proper system and not the stereotype system. 9 baje, 10 baje, 11 baje, 12 baje. Sometimes an appointment might be taking 20 minutes. Sometimes it might be taking 1.5 hours. So where does that system of 1 hour appointment trap falls in? So you keep a spacing of your appointments in between, and you can actually, you can say, rest be assured of this part, that the patients will value this aspect of yours pretty well. Ultimately, the bottom line of a few things is, in the satisfaction part, listen carefully, be responsive. Listening carefully is very important, because most of the times the patients have this problem. डॉक्टर ने हमारी बात ठीक से सुनी ही नहीं. All over India, I would say the patients have this problem. अरे पेशेंट को ठंडा पानी पीने से रिलीफ मिलता. I know it that you know the answer, but let the patient speak up first. He'll feel more connected to you. कि हाँ यार, डॉक्टर ने ढंग से सुना, diagnosed किया, and then told me the treatment plan. But if you have been pre-jumping to the conclusions without listening, the patient might be saying पानी पीने से रिलीफ नहीं मिलता है. आपने पूरी बात सुनी नहीं. Sometimes, just giving an example, it's not only about the thanda pani relief or something, but it can be a similar thing also, what I mean to say. So be responsive. If the patient has come to you with a complaint, always take an action. Always try to take action. मैं हमेशा believe करता हूँ कि एक बद्दुआ में ज्यादा ताकत है एक दुआ से. तो अगर आप पेशेंट को अटेंड नहीं कर रहे हैं उसके डिस्ट्रेस के टाइम पे, you sure are going to get a label of being an unsatisfactory dentist. The patient will not be satisfied, and you can be ready for a negative Google review as well. We don't many times understand the needs and the expectations of the patients. The patients sometimes lay down themselves. हमारे को चाहिए वेट ना करना पड़े और काम आप पूरा मन से करो, काम सही करो. Many patients will have only these two expectations, but we think that the price is the expectation. अरे वो होता है 5-7% में, और 93-95 में नहीं होता है. If it is happening in your practice, then you have to understand that it is happening because maybe you're prone to bargaining. Maybe your aura has been created like this right from the start. You never bothered to do it. You never bothered to change it. So you have to rework on your brand image, whatever it is there. Always take patient feedback. Whatever the patient wants to say, you have to listen with open arms. The patient will sometimes say, डॉक्टर साहब मुझे आपका ट्रीटमेंट बहुत अच्छा लगा, पर आपकी ये बात अच्छी नहीं रही, आपके पर्दे बहुत मैले हैं. The next time patient comes and he or she sees those curtains in a chaka-chak condition, or even in a new ones, पुराने हो गए हैं तो साफ भी नहीं होते इसलिए whatever reasons you give, नहीं ना पुराने एक्चुअली इनका रंग ऐसा है, you can give so many excuses. But if the next time patient comes after 3, 4, 5 days and he finds those things changed, trust me, he will feel that his or her opinion was valued for. And that is what we actually want. The patients feeling valued in our clinic. ऐसे भी और वैसे भी, both the aspects, they will always there. Then measure and improve. I told you, if you can't track it, you can't measure it. Even if you don't measure it, you don't know whether you're growing or not. So bargaining is inversely proportional to patient satisfaction in most of the private clinics. Why? If I have to ask you in one word, in one line, why do patients bargain? Apart from the reason of typical Indian mentality, I understand that, I buy that argument. But other than the reason of typical Indian mentality, what are the reasons that you think patients resort to? Put it in the chat box. I want to see how many of you are awake till now. Put it in the chat box. What is the commonest reason that you believe bargaining happens in clinic? Why does it happen? I'm waiting. Put it in the chat box. Nobody is watching. Nobody is listening. Habit तो हो गया ना राजीव. Typical Indian mentality हो गया. वो habit है marketing. Price thing. Okay. Because we allow it to happen. Yes, we allow it to happen. Satisfaction, cost comparison with others. They don't find value, not satisfied. Of course, not satisfied, cost versus value. Those are a few things. Thank you so much. Internal satisfaction. Yes, thank you so much for your views. Because they visit multiple dentists before treatment. Yes, absolutely. You should feel proud in that, Dr. Disha. I'll come to that. Don't worry. So what do you all think is the biggest reason? Is it the money? No one of you mentioned money. The simple answer is it is an indicator of cost versus value. How well the patient is being treated in the practice. The how well is not necessarily the quality of care, but to how content is the patient with the care they received, or how much the value they received in the cost they paid for. किसी ने 10 रुपए खर्चे, he will always want कि 10.5 या 11 मिले. But if in return of that 10 rupees he gets 9.5 rupees, he'll feel यार नहीं यार पैसे तो यार over something is wrong. So you need to understand that a few things under promise and over deliver works the best. We do the reverse. We promise them, you can say, the moon top, and we land on the tree top. So that is the problem with us. And the comparison of the cost may not be the actual reason. I rather feel that you should always do a consultation with an open mind. Any new consultation, कोई भी नया पेशेंट आपके पास आता है ना, आप मान के चलिए आप उसके थर्ड डेंटिस्ट हैं. नंबर 1 डेंटिस्ट है उसका ओरिजिनल डेंटिस्ट. आई एम प्रिज्यूमिंग इट ऑफ कोर्स. नंबर 2 डेंटिस्ट है यूनिवर्सल डेंटिस्ट, डॉक्टर गूगल. नंबर 3 डेंटिस्ट इज यू. So whatever you mouth, whatever the words you're going to speak, you have to be very, very conscious that whatever opinion you give is always or should always be verifiable. You need to understand that, because people will have all the reasons, all the ways to compare and contrast. So this is the way things work. So if you are fed up of bargaining in your clinic, you can try negotiation. You say, this is bargaining, this is negotiation. What is the difference? Let me give you a few pointers to that. So negotiation, of course, is a difficult task to mentor, because the normal commonest question we get is type of patients and how to tackle. Doctor, can we reduce the price of tooth extraction? Can we reduce the price of this? Because pricing is the most important thing for many of us, that we believe that the patients will do it. I told you, patients value health more than all of us. They will never search for the cheapest root canal specialist in the town. They will always search for the best root canal specialist. Although they want to pay the best, the worst, or the cheapest price, that is a different thing altogether. But this is the way things go. So nobody likes this stage, because we all have spent so much money on education, establishing our clinic. There are so many running costs. और आज के सेशन के बाद तो आपकी कॉस्टिंग और बढ़ने वाली है, because I've given you an insight into this video. Of course, all of you IDEA Hadapsar members, you will be getting this recording in your Facebook group as well. I'll upload it most likely by before midnight. I'll upload this tonight only. So you'll get it for a repeat watch, whatever time you want to. You can concentrate on that cost, make up and check up your own cost. But this is the way things work. So you want that, but we all want, they don't want a bargaining in our center. We want that जो price मांगे वो हमें मिले. The unfortunate problem is we don't know how to calculate the price. Sometimes we are too exorbitant in asking. Sometimes we are too undervalued in asking. And that is what actually makes a difference in our clinic profitability. But then, जहाँ पे bargaining नहीं चलती है, वहाँ पे negotiation चलती है. So you will find here, why should we learn to negotiate? What is the difference between bargaining and negotiation? So the only thing is, people will come to you, they always say, Doc साहब, अब तो सारी family का काम आप करते हो, मेरा तो इतना काम करने वाला, हमारे को एक पैकेज ही बना दो, हमारे को एक डील दे दो. And trust me, I hate that word in my clinic. If somebody uses that word deal and a package, I actually hate that. I'll give a very small example over here. Somebody asked me once after his procedure, he's gotten something done of the value of 25,000 from me. Now he said, Doctor साहब, अब बाकी ये आपने procedure कर दिया, तो अब मेरी fillings देखो और कोई रहती हैं, वो कर दो. I said, yes sir, you have 5 fillings to be done. Oh, sorry, 6 fillings to be done. There should be normal class 1 fillings only. Of course, I explained in the patient language. I'm presuming, I'm just laying out a fictitious situation to you, but which actually happened. I'm just using the current timings for that. It happened actually 10 years back. So, Doctor साहब, अब तो आपने सारा काम कर दिया, अब तो 5+1 कर दो आप. How much are you charging? 1,000 for a clinic or for a filling, for example. So, Doctor साहब, अब 5,000 में 6 fillings कर दो. Now, the simplest thing is that people will fall in that trap. कि चल यार 25,000 का काम करवाया, अगले ने एक फिलिंग फ्री में कर देते हैं. I say always, never ever do it. Never ever do it. Tell the patient, if I'm going to do these fillings in one go and not in multiple sittings, who is going to gain out of that? You. How? आप आएंगे, टाइम निकालेंगे, पेट्रोल जला के आएंगे, अपना काम छोड़ के आएंगे, यहाँ पे आके करेंगे. मेरे को तो एक में अगर 5 मिनट लगते हैं, तो मेरे को 5 में आधा घंटा लगेगा, 25 मिनट लगेंगे. तो it is not going to make any difference to me in that regard. So if I am doing all of those, you're saving on your office time, you're saving on your petrol, you're saving on your repeat visits. I'm going to still take that much amount of time. So who's going to gain it? Although if I'm using a rubber dam, I'll need to reapply that. I know that part. But let's put it that way. Who's going to gain? You. So if I am saving you so much, your petrol, your time, you, sir, should not pay me 6,000, but 7,000. Because I have saved you much more than that by doing all that work in one sitting. So I want to be paid for 6+1 and not 5+1 free. Trust me, that patient never ever bargained in my practice ever after that. Usko pata lag gaya. And the second thing is, why do we need to realize जो 25,000 दे सकता है उसको 1,000 देने में क्या प्रॉब्लम है? But we fall into that trap, and there becomes the beginning. शुरुआत वहीं से होती है बार्गेनिंग की. मॉल में जाके कोई चूचू करता है या डिस्काउंट दे दो थोड़ा सा. सॉरी सर, रेट्स आर फिक्स्ड. जो डिस्काउंट लगा वो पीछे से लगा, बारकोड में है, सब कुछ एंटर्ड है सिस्टम में. बट लोकल एरिया शॉप पे जाएंगे, विल डू ऑल सॉर्ट्स ऑफ बार्गेनिंग, whether it is a food item or you can say a fabric or anything else or a usable or a consumable. We'll try all sorts of things. वो 20 रुपए, 30 रुपए, 10 रुपए की भी कई जगह रेलवे में मिलती है. वो कॉफी को हम 500 रुपए की स्टारबक्स में पीते हैं कि नहीं, वहां पे जाके कहते हैं स्टारबक्स वालों, ये कॉफी की औकात 50 रुपए की, 100 रुपए की है. We are paying for their brand, we are paying for their ambience. We are not paying for their coffee, and we paying that happily. But local 10 रुपए की चाय वाले के साथ हम लोग बहस करते हैं. So this is the way you have positioned yourself in your market, that this Dr. XYZ is prone to branding or not prone to or not prone to bargaining. That decides the behavior in your clinic. वो 25,000 वाला पेशेंट क्या बोल के जाएगा ज्यादा से ज्यादा, डॉक्टर साहब आप तो बिल्कुल मनी माइंडेड हो, आप तो बिल्कुल प्रैक्टिकल हो, anything of that sort. And say, sir, we are incurring cost on every procedure. If you want me to do, you can say cut corners in that. You're happy with my procedure, so you are opting for these restorations also with me. If you were not happy, you would have never said it to be done from me. You would look for any other doctor. You're happy because I gave you a good service. Now, for the reason of cost cutting, if you want me to cut corners, I can do it. You can pay me not even 4,000 for 6 fillings. The moment patient hears this, he knows this is a trap. And if he says 4,000, पता नहीं कौन सी फिलिंग कर देंगे, 2,000 वाली 4,000 में कर देंगे, चाइनीज फिलिंग ना कर दे. Everybody is aware of it. So you need to create an awareness yourself. वो वहीं से आएगी आपकी patient consultation से. So handling bargaining and negotiation, dentists do have difficulty in handling negotiation because we are not taught about. Taught तो में बहुत कुछ नहीं भी किया गया. The marketing, the management, the patient handling, the consultation, the finances, the medical legal, बहुत कुछ नहीं किया गया. If I go on, the list would be endless. But then again, quality didn't. हमें लगा कि हम अच्छा काम करेंगे, अच्छे मटेरियल यूज करेंगे, तो पेशेंट्स अपने आप अच्छा पे करेंगे. It is an unfair world. We need to realize that. So today's dentists are intelligent, hardworking, dedicated to constant self-improvement, but they need to develop the negotiation skills as well. It is time that we become good negotiators. We try to throw the ball in others' court, playing lawn tennis, using role reversal, role rehearsal. I told you, be prepared for all the patient questions. Just excuse me for a minute, please. Just half a minute only. Okay, guys, I'm back. Sorry for that trouble. So we all need to be good negotiators, and we need to develop that skill as well of talking and talking really well. Let me explain you the difference first between a negotiation and a bargain. Are both of them same? No, absolutely not. The dictionary meaning might be the same, but they are actually not each other's synonyms. They are two different words with different meanings. Let's see a bit of this. So bargaining is also only about the price part, but the negotiation is never used in connection with price alone. Of course, बहुत लोग करते हैं ना, मेडिकल लीगल सिनेरियो आ गया तो उसमें एक डेंटिस्ट ने पेशेंट का नुकसान किया, उसने किया, चलो दोनों टेबल पे बैठ गए, हम आपको रिफंड दे देते हैं, हम आपका ये कर लेते हैं, all those things. Whatever you do, you come to an agreement. That is called as a negotiation. Bargaining is often done in an informal situation. और डॉक्टर साहब थोड़ा सा तो कम कर लो. नहीं, मैं तो डॉक्टर इतने ही देने हैं, मैं इससे ज्यादा नहीं देने. But then negotiation can be used as a description for situations other than just the price part. चलो इसके साथ कम से कम ये तो दे दो, एक ब्रश दे दो फ्री, like that, those things. Patients will also try the same thing with you sometimes. But then bargaining is only about winning. नहीं, मेरे charges are fixed. Somebody would say, नहीं, थोड़ा सा कम कर लो. नहीं, the deal doesn't go through. But negotiation actually wants both the parties arrive at a win-win situation. Bargaining में जीतना important होता है. Negotiation में arriving at a right decision without a priority over, you can say, a personal gains. You can say both the parties enjoy the benefits of negotiation. Negotiation is sensible. Bargaining starts off as a selfish thing, but negotiation is still sensible. So both the parties in bargaining actually try to satisfy their desires. कोई भी रैशनल बात नहीं करता. डॉक्टर साहब, हमें पता है जी कितने का होता है ट्रीटमेंट, आप इस चीज को ओवर चार्ज कर रहे हो, इसको ठीक रेट पे लाओ. सॉरी सर, आवर चार्जेस बिग बिकॉज वी नो आवर कॉस्ट, वी कांट रिड्यूस इट मोर देन. आपकी मर्जी है, ठीक है. एंड द पेशेंट लीव्स. The conversation goes into that part. The negotiation actually involves patient telling the proper value to the patient in that regard, so that they come to a solution that what they are getting a package in terms of that, where you can combine your internal marketing thing also. Bargaining is more of a debate thing. जिसको ज्यादा बोलने की स्किल, जिसकी वर्बल स्किल ज्यादा, जिसको मैनिपुलेशन स्किल ज्यादा, वो जीत जाएगा. Negotiation में there is a communication. You need to have good communication only, and you can say everybody is looking for a proper middle road or a proper settlement. And negotiation does not always mean कि आप discount दे के छूटोगे. It is all about that part. So in dentistry scenario, when though the two parties will keep on haggling over the price of the product or a price of a service, and when they don't arrive at a conclusion, this becomes bargaining. But when the product is a service kind of a thing, and both the parties are not valuing this thing, they need to understand that the bargaining is still on. The negotiation involves value instilling in each other's mind. So the question is dentistry a commodity? No, we are not selling goods, we are selling services. So bargaining is an agreement between the two parties. क्या जहां पे आप इतने का आप दे रहे हो, 1000 का आप 800 में दोगे. That is a mutual agreement. But negotiation is actually explaining the patient over the multiple aspects. हम आपको वेट नहीं करवाएंगे, हम आपको टाइम पे ट्रीट करेंगे, हम आपको प्रॉपर सर्विस देंगे. All these are part of the negotiation aspect. ये आपको बाकी जगह नहीं मिलेगा. Like that approach. Because ultimate aim should be patient satisfaction only. The patient is satisfied with his queries first, then with the treatment part first. If he's satisfied with the queries part, he'll start the treatment. If he's satisfied with the treatment part, SAB and SAB, he will pay you full money in the end or before the end. And then that is the reason I say bargaining is inversely proportional to patient satisfaction. So you need to remember that part very clearly. So patient satisfaction may be a perception. As I said, there are no proper trackers for that for you to measure. The patient can give you a score on a scale of 1 to 10. But this perception is a reality. Most patients will also sometimes not have any method कि कैसा था. So they rely on a proxy. How did the clinic make them feel? Valued or not? That is the way they will decide actually whether they were, you can say, satisfied or not in your clinic. 10 years down the line, they will not remember the procedure done, in how many sittings, how much money they paid, but they will remember the pain that you gave them. उस डॉक्टर ने पेन बहुत किया था, बाबा मैं नहीं जाऊंगा उसके पास, या मैं नहीं जाऊंगी उसके पास. How did the clinic make them feel? That stays on in the patient's subconscious memory forever. If the practice makes them feel valued, respected, and cared for, they will infer that they have received good dental care. Every actual treatment 100% perfect nahi hota hai. It is not equivalent to a celebrity dentist outcome, but it is serving the patient's purpose. It is making him feeling these aspects. We call it VRC, valued, respected, and cared for. So if they are having VRC in your practice, they will never bargain. and they will choose you as their repeat dentist. They will give you referrals. They will be retained as your patients. So the bottom line key is nobody remembers the prices. जो प्राइस देके जाता है ना, जो आज आपको 1000 का 800 कह रहा है, वो कल को उसको कोई 600 की ऑप्शन मिल जाएगा, वो आपको 1 मिनट में डंप करेगा. Because that relationship is based on discount. If somebody is giving a better discount, he'll change loyalties. हम में से बहुत सारे लोग लैब चेंज नहीं करते हैं क्या? अगर कोई लैब आपको लोकल लैब कम रेट में काम, I'm not saying all, but some of us. I know a very good friend of mine. He changes a PFM lab's PFM crown for a difference in 25-50 rupees. Giving her an amount, दूसरे का 25 या 50 कम हो, changes the lab. I ask him, यार तू तेरा पुराना टेक्नीशियन, तेरी लैब is settled with you. ये 25-50 not equivalent to even 2 cups of proper tea that you are drinking. ये 25-50 की क्या वैल्यू है? नहीं, वॉल्यूम की बहुत वैल्यू है. 20, 30, 40, 50. What difference does it make? एक भी क्राउन रिपीट हुआ, एक में से भी पेशेंट पेमेंट पेंडिंग दे गया, तेरे वो 20, 50, 100 सारे पूरे हो जाएंगे एक ही में, एक ही काम में, एक ही क्राउन की पेमेंट में. Because the outcomes might not be perfect. What you have been getting from your old lab, which is in sync with your mind, but still people do it. So जो वो mind game है वो चलती रहेगी. There will always be some dirty apples in your full casket. It does not mean every apple is a dirty. So the patient experience has to be looked at from the various factors. In my perception, the patient satisfaction has 5 main components. You have to clearly and quickly comprehend what the patient's needs are. Patient को चाहिए कि आप दे पाओगे कि नहीं. डॉक्टर, मैं 9 बजे फैक्ट्री जाता हूँ, 8 बजे रात को वापस आता हूँ. A very common thing I encounter in my practice. Because mine, as I told at the start, is an industrial town. So, what do? डॉक्टर आप मेरे को 8:30 9 बजे का रात का टाइम दे दिया. I clearly tell, sorry sir, once or twice it is still possible, I may be able to do it, but the rest of the times if your treatment is going to be long, I'm sorry, I'm not going to do it because it is my family time. I can't continuously keep on encroaching it. Flexibility होना एक चीज है, rigidity होना एक अलग चीज है. But then flexibility at your own cost of comfort, own sleep, own family is secondary to me. So convey it. वो कोई बात नहीं, कर लेंगे. देन वो बाद में हम टाइम नहीं देते हैं, पेशेंट को जल्दी बुलाते हैं, भागा भागी में आता 7 7:30. टेल द पेशेंट, इफ यू वांट टू गेट योर ट्रीटमेंट डन, यू हैव टू मेक अप योर टाइम. क्रिएट द वैल्यू, क्रिएट द नीड इन द पेशेंट्स माइंड कि ट्रीटमेंट नहीं कराओगे तो रातों को दर्द से जागोगे. एंड उनको बोलो आप 9 बजे खोलते हो, आपके एरिया में तो बहुत सारे लोग हैं शायद 10 10:30 11 बजे खोलते हैं, तो यू आर अ डिफरेंशिएटर इन दैट रिगार्ड के कम से कम 9 बजे. सुबह 1 घंटा लेट चले जाओ, आई कैन गिव यू 9 o'clock सिटिंग. वी स्टार्ट वर्क राइट एट 9:05 a.m. My first appointment is 9:05 a.m. daily, except Sundays of course. So we usually start the work on time. So tell the patient in that regard, whatever your differentiator is. But if you are ready to budge, कि ठीक है हम रात को लेट टाइम दे लिया करेंगे, your choice, your choice. You have to see which comes first to you, money or your own family. I'm sure the answer for you would be family. Most of you. If your answer is money, you really need to have a hard look at your own priorities. Then gauging the patient expectations and managing them. The patient wants an interior smile makeover. You haven't done, you can say, a good one in a long while. And you're not very confident of doing it. And the patient says, मेरे को ऐसी स्माइल चाहिए. ऊपर से आप हाँ हाँ कह रहे हो, अंदर से आपका बैंड बजा हुआ कि आप क्या करूं. So always explain carefully that maybe you're not the right guy to handle it, or maybe you will call a consultant, maybe you call an associate, whatsoever. Always tell the patient very, very clearly rather than doing a shabby job at the end and spoiling the relationship, because that spoiling the relationship leads to a worse thing, which I'll tell you. So success is getting what you want, happiness is wanting what you get. So always cross the bridge of patient expectations by performing beyond them. Under promise and over deliver. एंगर पेशेंट को आएगा ना, तो हमेशा वो आएगा हिडन फ्रस्ट्रेशन से, और फ्रस्ट्रेशन आएगी जो आपने एक्सपेक्टेशंस दी थी वो अनमेट हुई, तो वो पी जो है आपका नेगेटिव में जाएगा, पी माइनस ई जो एस पॉजिटिव नहीं आएगा, एस इज इक्वल टू पी माइनस, आई होप यू रिमेंबर इट. सो द यूजुअल कॉज ऑफ फ्रस्ट्रेशन एंड एंगर इज बिकॉज ऑफ ओवर प्रॉमिस एंड अंडर डिलीवरी. हम उल्टा करते हैं ना, अंडर प्रॉमिस और ओवर डिलीवरी करोगे नोबडी विल माइंड इट, बट अगर ऐसे करोगे तो पीपल विल श्योरली माइंड. So the patient satisfaction can be from different perspectives. The wait was too long, the room was not clean, the provider never really listened. इसमें पैसे तो कहीं आए नहीं है. What was the patient's experience? What was the patient satisfaction level in that? So you need to understand, pricing is never in the top 3. It may be in the top 5 of the patient's requirement of looking at a dentist, but it is never in the top 3. So अगर आपको आज तक यही लगता रहा तो you are mistaken badly. Then stay updated on technology and procedures that give you better outcomes. हमने income side में discuss किया था, invest in those things which give you more revenue, which increase your practice production. Then the old jack of all, master of none. Trust me guys, in today's times both of them are not valid. आजकल जमाना जैक ऑफ ऑल मास्टर ऑफ नन का नहीं है. इट इज द टाइम ऑफ मास्टर ऑफ फ्यू. आपको एक नहीं 2 या 3 चीजों में स्पेशलिटी हासिल करनी है. ऑफ कोर्स आई डोंट रिकमेंड कि आप सब में करो. इफ यू कैन डू इट वंडरफुल वंडरफुल, बट those works, those tasks which you are not doing well, always delegate them. Delegate them to a better person who can perform that job better than you. And trust me, if you follow these 1 to 5, you can just be assured that the satisfaction components would be there. And why should patient satisfaction score as a top-notch priority for everyone, for every healthcare personnel, and not only the dentist? Because of course, smile is equal to money, of course. It gives us good publicity. It gives us, of course, monetary value, more patient retention, more footfall in clinic, of course, via that, creating entry for patients by attracting them from this option, then giving that extra zing, extra value addition in the patient care. It spreads like a wildfire. And of course, when you're doing all these things happily, you're investing in better things, better gadgets, better materials, you're giving superior treatment results. And when I said, you told spoiling of relation in the anterior case, if you satisfy one patient, it reaches 4 new patients. But if you spoil one case, disappoint one patient, it is going to reach 10 potential patients. As Vincent Lombardi said, it is very hard to garner one patient. It takes months to attract one, make one patient, satisfy one patient, go through all that channel of diagnosis, consultation, treatment planning, internal marketing, and making the patient a happy and a satisfied one. And all the new patients have to walk that channel. But the old patients are already walked through that part. They already know the system of your clinic. They're happy with you. They're happy to stay with you. You need to understand. You need to understand that this thing should be there. So always concentrate more on retaining your old patients, because that is going to give you more of satisfaction. And high satisfaction will pull in new patients, courtesy the value of tongue. जो ये डॉक्टर कहता है वो ये करता जरूर है. So maybe an old-fashioned obsolete, but it is a marketing strategy, and word of mouth still triumphs over many things. Of course, you can't ignore the new ways of external marketing days are there. And all these things is that whatever the patients get done from you, they will go and narrate those experiences. And that is known as sharing your experiences. They will share, yes, I went to that doctor, wonderful. इतना सा भी पेन नहीं हुआ, इतना सा भी वेट नहीं करवाया, तरीके से समझाया, तरीके से काम किया, प्रॉपर इंस्ट्रक्शन दी, मजा आ गया. मेरा पहला डेंटिस्ट इनमें से आधा भी नहीं करता था. अब ट्रीटमेंट पास तो इस 4 चीजों में से एक चीज थी, बाकी 3 चीजें वर द पैकेज ऑफ योर इंटरनल मार्केटिंग which led to patient satisfaction. अब वो ट्रीटमेंट का कुछ पार्ट में बी योर पेमेंट पार्ट. सो ओवरऑल आपके 25% का हिस्सा है, शायद कुछ हिस्सा द पेमेंट पार्ट, और आपने उसको 90% बनाया हुआ. द थिंग विच इज एक्चुअली 5%, 10%, वी मेक इट 90 और 95%. प्राइस इज द ओनली क्राइटेरिया. लोग एग्जांपल देते हैं जियो की. सर जियो का मॉडल देखो, डी मार्ट का मॉडल देखो, उन्होंने कितने महीने तो पहले फ्री किया, उसके बाद उन्होंने अपना प्राइस रेज कर दिया. द थिंग इज वॉल्यूम. डेंटिस्ट दिन में 50 पेशेंट नहीं करता है. यू नीड टू अंडरस्टैंड दैट पार्ट. वी नीड डू ओनली अ लिमिटेड पेशेंट्स एंड वी कांट डू अ फ्री थिंग पहले एंड वो करें. वो कोल इकोनॉमिक्स थोड़ी है, उसको कोल इंडस्ट्री में रहने दो. डोंट मिक्स दैट विद डेंटिस्ट्री. You have to remember, a satisfied customer is the best business strategy, because a satisfied patient, a retained satisfied patient, is a great practice builder. आपकी वैल्यू इंस्टिलिंग इतनी होनी चाहिए कि पेशेंट को डर लगे, आई मे नॉट लूज अ गुड डेंटिस्ट. इफ यू आर लूजिंग दैट पेशेंट इज अ बैड पेशेंट फॉर यू, बिकॉज ही इज इंटरेस्टेड इन सीइंग द प्राइस ओनली. हेल्थ केयर इंडस्ट्री इज नॉट अबाउट प्राइसिंग. बहुत लोग आंसर देते हैं, आपने कभी हार्ट वाले से उसके स्टेंट का पूछा, इतना महंगा क्यों डाल रहे हैं? सर्जन से गारंटी मांगी है कभी? People react badly. Dentists react badly. They take it on their ego. Don't take it on your ego. Don't take it on your ego. Explain the things. पेशेंट के मन में आपकी इतनी वैल्यू होनी चाहिए, डॉक्टर यार इसके पास इतना कुछ अवेलेबल था, मेरे लिए हर मामले में ये परफेक्ट था, कहीं ये डॉक्टर छूट ना जाए. उसमें प्राइस रेज भी आता है. I tell my colleagues in my workshops, have you ever tried raising the prices? Said after your advice we did it, and we were luckily surprised that the patients who were old, they actually did not mind. क्यों? पेशेंट के माइंड में है एवरीथिंग अराउंड यू इज इन्फ्लेशनरी. तो हर चीज का प्राइस बढ़ रहा है, तो ट्रीटमेंट का कॉस्ट भी बढ़ेगा ना. सो अंडरस्टैंड the customer experience model, the patient experience model, complete understanding of the patient's expectations, improving your systems, processes, products, and training, higher efficiency, quality. Of course, if you're providing higher quality, you can lower your operating cost, working cost, and that way you can give a decent pricing. Of course, this may be bypassed to this level as well. In our case, this is the journal model of the customer experience. You can skip this part, realize high customer satisfaction levels, retain customers, improve market share, and the cycle goes on. The bottom line is to create excellent patient experiences in the clinic. So I hope I have not been preachy enough in this regard. So let me give you the carry home gyan. So creating value and making it visible are the key power moves in the schedule negotiation when you're doing, you can say, choosing between bargaining and in bargaining you can't leave the party to puzzle through the possibilities. आप देख लो, मैं चाइनीज यूज करूंगा तो मैं आपको 1000 का 500 भी चार्ज करूंगा. Don't go into that part. Don't put the patient into that trap, because the patient चलता वो भी है, हाँ चलता है, निकल गया तो आपका, हमारी कोई गारंटी नहीं. You are actually making yourself a, you can say, one stop shop where you convey that हम घटिया चीजें भी रखते हैं अपने क्लाइंट में. Then you need to understand, if the value disappears, आपकी वैल्यू खत्म हो गई तो आपका बार्गेनिंग पावर एंड इन्फ्लुएंस भी खत्म हो गया. So value creation is one part you have to instill very clear. Then costing is one of my favorite subjects. How to raise your, first lockdown में मैंने एक formula बनाया था, how to raise your patient treatment charges now that our costing has increased. Those videos on YouTube, I'll be sharing with you the link. And second lockdown में April में June में मैंने costing का formula बनाया था. The GPM formula which I took was prevalent in all over various industries everywhere. The NPM formula was made by myself. So again उसके भी videos हैं. तो you have to understand आपको एक procedure कितना cost करता है, उसके बाद आप उसको charge कर सकते हैं. Without that, I believe that you won't be knowing only कि आप profit में है कि नहीं है. अगर आपका PFM आपको 500 रुपया 2000 कॉस्ट करता है और आप 1800 चार्ज करें तो आप बहुत बड़े मूर्ख हैं, या आप इवन 2200 भी चार्ज करें तो 200 लेके जा रहे तो आप बहुत बड़े मूर्ख हैं. I would say that openly. You need to understand what is your costing for that procedure. So look at the holistic view, look into all costs. 26 तरह की आपको दे दी मैंने for composite. इसी तरह की बनाएंगे आप, बाकी प्रोसीजर के लिए भी बन जाएगी आपकी। नहीं तो फिर वही है, मीमोडोंटिक्स में हम लोग पोस्ट करते रहेंगे, डेंटिस्ट्री इज डूम्ड, डेंटिस्ट्री का कोई फ्यूचर नहीं है। दिस इज अ ब्यूटीफुल प्रोफेशन and it is found by all of us. If we are not valuing it, no, why do we expect the patients to value it? Why do we expect the MBBS people to value it? Why do we expect the government to value it? हम आप खुद नहीं इज्जत करते हैं तो बाकी दुनिया कहाँ से करे? आप does not mean all of you, I mean the in general all of us, I mean to say. So अगर मैंने आपके दिल को कोई ठेस पहुंचाई है तो जप नाम आश्रम series was my favorite, so really sorry. So thank you so much for your patience in watching this. I hope I've stuck to my scheduled time. Yes, I have. I told you 1:30, 1:40 minutes. So it's 1:37 minutes only. So this is my YouTube channel link, youtube.com/c/Dr. Bhavdeep. If you forget, go to YouTube and search Dr. Bhavdeep Puja. You already have that on your brochure. Just subscribe and hit the bell icon. I keep on posting a video every alternate day. As on 10 February, 415 वीडियोज है और ये चैनल मैंने रिवाइव किया 1 जुलाई 2020 को, ऑलमोस्ट 1.5 साल पहले रिवाइव किया मैंने ये चैनल। सो उससे पहले एक वीडियो था 2008 से लेके 2020 तक, देयर वाज ओनली वन वीडियो। सो 415 वीडियोज ऑलरेडी हैं, ऑल मेड इन दिस लॉकडाउन, ऑल पॉसिबल टॉपिक्स इन बेसिक फॉर्मेट फॉर ऑल द कलीग्स. You can watch those from MLE, finance, and of course the practice management part. So I run 2 WhatsApp groups. As I told you, I started my online education sharing on August 2016 in somebody else's platform. Then I started my own WhatsApp community on 10th Feb 2018. So isko bhi 4 saal ho chuke hain. I plan to limit till 6 only. These are platforms which are absolutely free and advertisement free education. We don't share, there is nothing, you can say, promotion allowed in these groups. Meri apni paid workshops are not promoted inside. It is all about that code of honor. I don't promote it. If you want to be added in these groups, be associated with me, do send me a message, I'll add you. I plan to limit these groups till the 6th group only, and 6th group is a little far only from getting filled up. So this is my KYC. Other than that, my number, my email, my website, whatever you wish to. My social media presence, all by my name only, Dr. Bhavdeep, except my page, since the profile is Dr. Bhavdeep, so can't be. So the page is by Dr. Bhavdeep Puja, where this is being streamed live as well. So do send me a feedback on your WhatsApp group, on your, you can say, Facebook group, on my page, on my personal number, wherever you wish to. Please send me your feedback. If you send in your WhatsApp group, I am sure Prateek would forward me all the same. So bouquets and brickbats, both would be welcome in equal measure. So thank you so much. I hope the wait was worth it. Yes, I took 4 days extra, but because of that emergency, it was unavoidable. I hope you understand. So I stop my share for question time from all of you, and I will change the settings also to unmute. You can unmute yourself and ask one by one by raising your hand. So please go ahead and ask about any questions that you have, that you may have in your mind over the past 2.15 or 2.25 hours. Go ahead, please. Okay. Zoom user, I don't know the name. That can only be after the treatment is done. Patients start bargaining before the treatment is done. That is where you have to use your negotiation skills. That is where you have to actually make the patient understand what you are offering to the patient. You're not offering the treatment part, you're offering the value part. But then if the patient does not get converted, you don't need to feel bad. I already said you can't treat everyone in your area. You can't treat 100 out of 100 walking into your area. Not everyone walking through your door is your patient. So if you lose such a patient, be happy that you lost out on a bad patient. That patient did not deserve you. For that, you have to value yourself first. Don't sell yourself short. That is the carry home point for all of you. If you are selling yourself short, if you are not valuing yourself, why do you expect the patients to value you? That is the bottom line for me. Thank you, Dr. Siddharth. Okay, yes. Yes, Rajiv.
For our old genuine patient, should we be rigid on rates or flexible for them who are genuine from last many years, sir?
That is the point. That is the point we have to think. If someone has stuck with us for that long, for so many years, he's not sticking to us for price. He's
Yes.
sticking to us for the package we are offering. उनको तो पहला क्रॉस मारना कि डिस्काउंट नहीं देना, पहले तो किसी को नहीं देना as per clinic policy. Apart from relatives, known people, doctors, those will be there. For that, you have to form a clinic policy: 10%, 15%, 20%. I believe the upper limit should be 20%, not beyond that in any case. But what your clinic policy says, stick to that. But for routine patients, old patients, absolutely not. Price should not be the differentiating starting point for all of you. Never.
Hello guys. What a wonderful, power-packed, informative session given by Dr. Ahuja sir. Still, किसी को कोई questions रहेंगे तो आप पूछ सकते हो, आप वहाँ पे type कर सकते हो, Ahuja sir उसको answer कर रहे हैं.
Till the time you are thinking about your questions, I'm picking a few ones from the, you can say, the Facebook page where this thing is doing. So, hi Ashish, hi Manu, hi Dr. Ramchandra, hi Ravi. Yep, thank you so much. Hi Vinay. Okay, hi Dr. Swati, hi Dr. Momita. Okay, Profit. Okay. Yes, sir. Dr. Swati Agrawala, how to decide our treatment charges? Dr. Swati, I answered this in the session itself. You have to work on your cost first. What does the procedure cost you? After that, what profit do you want to earn from it? That is the way you can actually calculate that. But if you are not aware of your numbers of costing, trust me, you are somehow oblivious of the procedures that you are doing in your practice. Your procedure might be actually more than what you are actually thinking that it is charging you. So please do work out on your costing. I gave the YouTube channel link. So there is a presentation by the name of More Profitable Dental Practice videos, series videos 1 to 5. Do watch those videos in sequence from 1 to 5 on my channel. And your all doubts about, you can say, costing would be clear. On the flip side, if you want to watch a summary of those, there were 2 videos done by me on 30th June on my dad's death anniversary, one with WDF and one with the WDA, costing and numbers videos, know your costing. So those are in an abridged form. The glimpse of that, you can watch that first before you go to the detailing part. But I'll recommend that you go from sequence 1 to 5 for those 5 videos. So thank you so much. Hello, Dr. Vinita ma'am, Dr. Rajiv Chaudhary, hello, Dr. Nikita, Dr. Parul, Dr. Sumedha, Dr. Pradanya, Dr. Daisy, hello all everyone. Hello, Dr. Zubair, Dr. Nimesh, Dr. Jagdish, Dr. Atamji, Dr. Urvashi, Dr. Kamarjeet, Dr. Swati again asked how to calculate. You have to know how to calculate using your own way of system. I've given you every breakup. What materials are you using? You can put in the entries, substitute my materials for your materials, and you arrive at a costing. You'll do that. So hi, Dr. Sneha. Hi, Dr. Renuka, Dr. Zishan. Hi, Dr. Manpreet. Dr. Manpreet asks, you charge 15% warranty premium upfront. Dr. Manpreet, I said, if the patient has a problem with that case, in those cases, I charge as replacement charges. It is not that I charge upfront at the time of the primary thing only. If that patient develops a problem, has an accident, has a mishap, and in those cases, we do take that amount to replace it. आप मारुति से इंश्योरेंस लेने जाते हैं तो आपको बोलते नहीं पहले वो 500 होता तब 1000 रुपए क्या किस चीज का चार्ज है क्लॉज का चार्ज तो इवन इफ यू गेट एवरीथिंग 100% फ्री आपका लेट्स सपोज कुछ बॉनेट का डैमेज हुआ which is a metallic thing usually the paint and the replacement of the bonnet is let's suppose done free of cost in insurance only you don't need to pay glass और plastic का जैसे पे करना पड़ता है ना 50% or some amount for example metallic thing है you don't have to pay anything still you have to pay 1000 as the clause charges so this is kind of those clause charges for my clinic I gave an example 10% for metal 15 for post PFM and 20 for zirconia you can do as per your charges for the procedure that you are doing and that is again that came with the logic that it comes with the fact that I'm not going to earn the same amount from that patient in the form of profit. I'm just going to cover my basic costing. That is my value added service to that patient, that he has a mishap, but I'm not punishing him for that mishap. And those things are clarified when the crown is inserted. The mishap has not happened. The primary crown is being inserted. We convey at that point of time. So I hope you get your answer, Dr. Manpreet. So hi, Gaurav ji. Hi, Dr. Milind. Hi, Dr. Vandana. Hi, Dr. Harshad. Yes, Dr. Akshata, they don't find value, not satisfied. Hi, Dr. Smita, Dr. Jagdish, Dr. Sonia, thank you so much for your feedback. Dr. Preeti, thank you so much for your feedback. Dr. Pradanya, thank you so much. Thank you, Dr. Jagruti. Dr. Nilesh is watching here also and there also. So great to see. So Dr. Bindu, thank you so much. Dr. Swati, thank you. Yes, thank you, Dr. Manpreet, for understanding. Okay. So let me pick up the things from here. Yes, hi Saurav, thank you so much for your feedback. Dr. Sneha asked, great presentation, thank you ma'am. Can giving freebies in return of Google review will sound like paid reviews to patient? How can we encourage them? No ma'am, it is actually kind of the way you present the things to the patient. I mentioned you can actually ask and request for a Google review, and when the patient does that, you can offer the freebie as a thing afterwards. You're not giving it beforehand कि अगर आप review दोगे तो मैं आपको ये दूंगी. You're not doing that, and you can just convey that thing in a smart way. It is your communication skill that actually decides how you're going to you can say do that transaction of speaking. So I hope you get the point. So thank you. I hope you understand. So yes, Dr. Swaprajat, thank you so much. Okay, Dr. Sonam says your lecture was excellent. Your words of advice with your vibrant personality kept us attentive. Thank you so much, Sonam ma'am. So when we, Dr. Nitin asked, when we ask people review, they think like we are asking their kidney. Again, Dr. Nitin, we need to be asking those things if we feel that the patient's vibes are good. I always schedule a patient follow-up appointment after 3 or 4 days, even for the done work or the completed work. So I always ask them to come on for a checkup and let's sort out what things are done. And I always keep a half an hour for that appointment. I have a system of appointments, so the patient, I presume, is coming on time, unless a problem happens at the last minute. That is understandable. But I presume that the patient is coming on time. The things are settled. So I'm just spending 5 minutes in that checkup part. So what exactly is there? The patient is going to be with me and say, okay, I'm fine, I'm done. If the patient is in a good and a jubilant mood, I would request the patient at that point of time for the feedback. But if we insist on pushing it from every patient, the patient will feel, yaar, kaam to pehle acha kar lete, aap wo maang rahe ho. That patient has that mindset. So, Dr. Pratik, I'm muting you, just disturbance was coming at back end. So patients will have that thing. So always, you can say, ask it from those patients who are actually, you feel that you've done a brilliant job and they are happy. You can make it out from their vibe. They have not done any bargaining at the last point also. They seem good with your treatment. Ask for a feedback from those patients primarily, not from all patients. And there is a way to put it. We have another patient sitting in the waiting and we ask for the patient's feedback. Trust me, मैं आपको webinar में बहुत confident, as Dr. Sona mentioned, a vibrant personality. I was the one who never even had a 1 or 2 pictures in the whole family album of a wedding. मैं इतना camera shy था. मेरा एक simple formula था, I hate camera and the camera doubly hates me back. तो हमारा ये approach था, हम दोनों का love and hate नहीं था, hate and hate relationship चलता था. It was the lockdown only which actually encouraged me to, or rather, I would give the credit to Abhishek and Anand of WDA, who actually wanted, sir, अब lockdown लग गया, practical subjects तो हो नहीं सकते, आपका टॉपिक तो ऑनलाइन भी हो सकते हैं, आपके तीनों टॉपिक तो ऑनलाइन हो सकते हैं, सो प्लीज गो अहेड, आपका पहला वेबिनार करवाएंगे. मैं कहा अभिषेक, मैंने कभी एक छोटा वीडियो नहीं बनाया, तुम मेरे को 2 घंटे का वेबिनार लेने को बोल रहे हो. नहीं सर, आपको करना है. I couldn't refuse. Both of them are very good friends, so I could not refuse them. So 21st March 2020, Gudi Padwa, was the first day, 2 or 3 days after the initial lockdown, कि मैंने जिंदगी में कैमरा इतना लंबा देर के लिए फेस किया. First webinar I did on a phone. So Zoom का तो ट्रेंडिंग ना, फेसबुक लाइव जाके किया, तो टीवी पे कोई रिकॉर्ड कर रहा था एंड ऑल दोस थिंग्स. Zoom का आइडिया नहीं था. So if you find me very comfortable, it is just a matter of practice, practice and practice. So similarly for feedback also, you have to do practice and practice. You'll win some, you lose some, it'll all happen. But remember one line, version 1 is better than version 9. ट्राई नहीं करेंगे तो कुछ भी नहीं मिलेगा. ट्राई करेंगे तो सबसे पहला आपका जो वीडियो होता है ना, इतना खराब और घटिया वीडियो होता है, आप दूसरी बार खुद नहीं देख सकते. बट दैट गिव्स यू एन इंक्लिंग कि हाँ, आई कैन डू बेटर नेक्स्ट टाइम. जब सबसे पहली बार कॉलेज में एक्सट्रैक्शन में फीलिंग करी थी तो कैसी करी थी, याद है ना? आई रिमेम्बर 30 स्टूडेंट आसपास खड़े हैं, इट वाज लोअर 4-5. वो मेरा हाथ शेक कर रहा है, मेरे सर ने मेरे हाथ के ऊपर हाथ रखा हुआ है, रोटेशन दिया एंड टक, एंड एवरीबॉडी लाइक, हो दांत टूट गया. साला तुमने 100 दांत निकाल ले, सॉरी फॉर द अब्यूज. तो मैं तुमने 100 दांत निकाल ले, तुम्हारा भी तो पहला दूसरा था, तुम्हारे को मोबाइल मिल गया, मेरे को फॉर्म मिल गया, सर ने तोड़ा, मैंने नहीं तोड़ा, मेरे हाथ के ऊपर सर का हाथ था. व्हाटएवर वे. Then sir come, actually I went into a slight kind of a mini depression. यार पहला दांत है जिंदगी में, स्टार्ट किया डेंटिस्ट्री और पहले दांत टूट गए. So sir told me when he took out the root, see the root is curved, the X-ray did not give us a correct you can say idea. So अगर मैं भी निकालता तो मैं भी तोड़ के निकालता. So actually that comforted me. So when we do a process, that is why I gave you that ideology of EACR: execute, analyze, correct, repeat. Virat Kohli wala formula. So do that. So you can say it is a constant thing of doing it. When you start doing the things repeatedly, it becomes a habit. So asking the feedback will become a habit only when you actually start implementing it, doing it in a wonderful way. So I hope you get the answer. So kidney नहीं मांग ली, kidney के बदले iPhone मांगना उनका. that is a better deal. Okay. Okay. So Dr. Ashish say thank you so for making topic so interesting. Thank you. Thank you. Dr. Ashwini says really good session. Thank you so much. Okay. Dr. Dharavade asks, if I'm pronouncing the name correctly, sir, should we consider the financial status of people living around our clinic area before deciding our charges? Sir, आप एक काम करिए, मेरे लॉकडाउन 1 वाले वीडियोस देखिए, how to raise your practice charges. That will give you a complete idea of what your charges should be. अब मैंने आपको पूरी जब ये राम कहानी सुनाई है तो मैंने आपको बोला कि आपके लोगों से ज्यादा आपकी इंटरनल कॉस्टिंग डिसाइड करेगी. हो सकता है मेरा प्रोसीजर मेरे को 1000 रुपए का चार्ज कर रहा है, कॉस्ट कर रहा है, आई मीन टू से, मैं उसका अगर 2000 ले रहा हूँ, आई एम अर्निंग 50% प्रॉफिट आउट ऑफ इट. बट इफ द सेम प्रोसीजर इज कॉस्टिंग यू 800, you can charge 1600 also. But if it is costing you 1600, you have to charge 3000 plus, or else you will be carrying home lesser amount. So not your people in your area, your costing should be the primary factor. All other factors, maybe your financial status of your area, will come secondary. Where I believe that if your people around you are affluent or rich, you will say, I'll keep higher charges. If people in your area are on the, let's say, lower side, class 3, class 4, they'll say, I'll keep lower charges. आपकी कॉस्टिंग फिर वो हो जाता है ना, आपको पता है कि आपकी टारगेट ग्रुप वो है, then you start investing in those kind of materials, and those things then get synchronous with your brand. So if you have to tie those things with you, I don't think that is a good option. So primarily your cost should decide, all other factors should come later. And how to raise your charges, do watch those 3 videos series that I did in first lockdown. So you'll get a great idea of how to raise your charges. Okay. So thank you, Dr. Harshad. Thank you, Dr. Manu. Thank you, Dr. Bhavna. Okay. Any more queries on the Facebook page or on this Zoom session? Any queries, please feel free to voice, or we end up for the day.
Any more queries? Okay, thank you so much, Dr. Ahuja sir, for such a great session. It was a very informative and point-to-point lecture. Thank you so much for all the magic tips given by you to enhance our dental practice. It was surprising to hear from you about various unknown expenses and we all will definitely work on this. Our gratitude to you for all you have done for this lecture. We appreciate you and your time you spent for this session. We enjoyed every minute of your lecture and it was very informative and interactive too. Thank you so much for this wonderful webinar. Thank you so much, Dr. Ahuja sir.
Thank you, Dr. Pradeep, Dr. Nitin, Dr. Rajiv, and all the EC team of
Thank you,
IDEA.
sir. Thank you, Ahuja sir. This is Dr.
Thank
Akshay
you.
Raut, President.
Okay,
Thank
okay,
you,
sir.
respected seniors, colleagues, and friends.
Okay.
And we encourage you to attend IDEA Hadapsar seminars henceforth also. We'll be conducting a lot of CDE programs which will enhance your practice. We are also conducting a lot of social activities through CDH and sports activities. Kindly, all the IDEA members, do tell your friends also to join IDEA Hadapsar, so our strength will increase. Thank you so much, Ahuja sir.
Thank you so much once again,
for that
and
informative
the
lecture.
player was all mine. Thank you so much.
Thank you, sir. Thank you.
Okay.
Thank you so much.
Bye bye. Yeah.
Yes,
This
sir. Yes, sir. Yes, sir.
session is closed. All of you can leave. Thank you.
Okay. Thank you so much. Bye bye.
you.
Take care.
Thank you,
Bye.
sir.
Take
Thank
care.
you.
Bye bye.
Bye, sir.
Bye. Have a nice day, sir.